Good morning, everyone. This is Priyanka Manwar from Group 10, and our topic of presentation for today is a pandemic recap, lessons we have learned. So basically, we research on many topics related to COVID-19 and this pandemic, but this topic I think is very important because it will help us to prevent, to be more prepared and to resilient when we have to face a new risk in the future. So first of all, on January 2020, the World Health Organization Director General declared that the outcome constitute a public health emergency, national concern. The world has faced a worldwide spread crisis and we are still dealing with it. This research represents a tough lessons that we have learned from the COVID-19 pandemic, global experiences and lessons with all interested and especially those that are responsible for the future healthcare decision making. So from the date, unprecedented event transpired and the world's population experienced a multitude effect. It affects our physical, psychological, sociological, and other economical field. From this new and aggressive virus, which is known as a SARS-CoV-2, that's a severe acute respiratory syndrome, coronavirus 2. So COVID-19 deaths were rising fastest between April 20 and May 24, 2020. In India, nearly 211,853 number of deaths were noted. In Japan, the number was 10,199. In Argentina, it was 63,865 and so on. A number of recovered patients from this virus in 2020. So out of confirmed cases of by Feb 11, 2020, it was 43,115. Out of these cases, only 4,200 patients recovered. So after dealing with such crisis, government came up with a COVID regulation from December 2020. Well, so only recovered vaccinated people can enter retail, cultural, and leisure facilities. Attendance at large events were limited and compulsory vaccinated and so on. So these were the protocol that was applied by government. So successfully overcoming such crisis does not only mean successfully eliminating its consequences and reducing its negative impact. Overcoming such crisis also involves realizing one's own mistake, shortcoming to respond to the ongoing crisis and constantly work on combating it. So we will truly overcome this crisis if we take something from it and if we learn lessons that will allow us to be more prepared, resilient when we have to face a new risk in the future. So in our opinion, some of this critical point must be stressed to inform present and future generation to discuss and plan so that if we have to face a new risk like this, we will be more prepared. So what has been learned from this ongoing pandemic? First of all, to build a resilient health system. The most important element of this pandemic preparedness is a resilient health system to rapidly detect, access, report, and respond to novel outbreaks. Although most high-income countries have robust health system, they often lack sufficient capacity to treat a large number of patients that has been suffered from COVID-19 or protect health workers from the infection at the beginning of this pandemic. Moreover, in this pandemic situation, they must share their knowledge and tools with those who unfortunately are less equipped with the win-win vision. We experience many challenges regarding the lack of several fundamental pieces of organizational structure. So in this subsequent phases, moreover, health system also demonstrated the impossibility to give people the access to the necessary treatment and screening strategies because of the exhaustion of resources in facing the initial crisis. So in fact, no organizational model were prepared to relocate under Israel forces to their duties, thus reducing this worldwide the power of program for prevention and cure. This resulted in a reduction of assistance of the patient. Lower income regions experience a complete collapse of their health and the economical system. The next point to be considered is to invest in vaccination diffusion and protocol. So as we know, prevention is the most cost-effective way to maintain the health of the population in sustainable manner. The ongoing COVID-19 pandemic is a reminder of the importance of vaccination. We already know that vaccination is one of the most impactful and it is a cost-effective public health intervention. It has eradicated smallpox, nearly eradicated polio. In recent decades, it reduces the incidence of infectious disease. So it is concerning though that it has been stated that if a similar practices involving scientific misinformation and social media has existed in a previous generation, these diseases would never have been successfully addressed. So it is now accepted that the only way to overcome this COVID-19 pandemic and to minimize the loss of life and return to some semblance of normality is through vaccination. Maximizing the vaccination diffusion and vaccine accessibility is a utmost important, whatever is the cost. So the diffusion of this vaccination program in many developed areas has been vigorously opposed by activities of anti-vaccination movement, and that's anti-vax activists. Vaccine refusal attitude has spread many where high resources setting exists, and the fact is a lower incident of lethal infectious disease is present. Paradoxical counterpart, a low resource setting, the vital importance of vaccination is typically well accepted. Social media and traditional media should cooperate in reducing the spread of sensitization and fake news. We suggest that social scientists should be urgently recruited, embraced by physicians to help understand and investigate how scientific misinformation can be so pervasive in modern society. Politicians and government should also held accountable to make courageous decisions to fulfill their mandate to serve and protect their constituents rather than seeking votes through supporting and even promoting popular but unfounded news. Third point to be noticed is to defend the integrity of science. The pandemic has provided to medical science in general the first true battlefield to test itself since the start of this century. Science won some important battle against the corona, but seems to have lost against unfounded social media campaign. Unequally, the greatness of the scientific progress, the presence of great researchers, they enabled societies to understand the virus, its mode of transmission, and the effective public health intervention. Unfortunately, the medical community was immediately required to satisfy the tsunami of questions that has been arised from the media due to peculiar approach to the information. The scientists tried to give a precise and comprehensible instructions with transparency and clarity. Mass information, moreover, has necessities, characteristics that was very dangerous for science. It should be quick, obtain an emotional response, and sometimes apply to a precise politically oriented vision of reality. The next point is to abolish rhetoric and adhere to truth. Considering the diffusion of this pandemic and its burden, almost everyone in the world played a role of potential patient, thus leading to an increase the request of proper information. In starting a trustworthy dialogue and counseling with the person, it is fundamental to adhere the intellectual honesty, clearness, and empathy, avoiding paternalism, rhetoric, and sensationalization. It is fundamental to educate how to read, understand, and be prepared. Doctors should be able to give adequate and personalized instrument to patients. Only in this way, the community we can start a new era of operation and trust. Otherwise, the response will be always inconsistent and vague, with consequent misunderstanding, disappointment, and confusion. To focus on equity, even before the coronavirus pandemic, social, economical, and health inequalities were the prevailing global narrative. This infection amplified long-standing systemic inequalities, including access to healthcare. Infectious disease should affect populations similarly, but this COVID-19 demonstrates that low-income people, those who are less educated, and ethical minorities are disproportionately affected. Of course, inequality is a non-mere geographical concept. Within the same nation and even inside the same cities, deep disparities exist between different groups. As known, healthcare is strictly linked to the economical and cultural status of people and countries. Wherever single government resists the necessary action to limit this disease spread, they must be forced to proceed on this path. So the solution should be finding a solution that will reduces the risk of patients' financial destitution are essential in accomplish this. The next point is to look at healthcare from a global perspective. This will be continued by another member. Thank you.
Good morning, everyone. This is Amrita, and I'll be continuing from here. So, our next point is to look at the healthcare for a global perspective. Since the rise of globalization, the world has become more closely connected, and the people can easily interact without facing barriers. No borders exist for diseases, and no borders must exist for the basic fundamental healthcare. The difficulty shown by the international organization in facing the first steps of the pandemic has been evident. And there were the developed countries received more vaccinations than the developing countries. The unequal distribution of vaccine doses throughout the world happened even within the higher income countries, and also the healthcare facilities, structures, and tools distribution from the high income systems to the lower ones must be promoted together for adequate and proportional growth in the infrastructures. So next point is to support. Next, please. Next slide.
America, 2 minutes.
There's no audio.
The next slide, doctor. I think there's something wrong with the.
2 minutes, doctor. Actually, I'm having some issues with my laptop.
Yeah. So our next point is to support one globe, one health approach to manage the ongoing pandemic crisis and to better anticipate the next one. It is of utmost importance to strengthen the foundation of an ecology of health, focusing on the interdependencies between the functioning of ecosystems, socio-cultural practices, and the health of human, animal, and plant populations taken together. The system within we live is a closed system, and the more we dysregulated, the more violent will be the reset to the equilibrium. So the true prevention starts from understanding the deep connection among environment, uses of the resources, and uncontrolled development. Even considering only the economical perspective and not the moral one, the cost of facing future subsequent pandemics could be even higher than reconsider worldwide the paradigm of an unstoppable economic growth. Even considering the economical perspective and not the moral one, the cost of facing future subsequent global pandemics could be higher than the planned anticipated economical gain that do not consider this approach. So next point. Next point is to make the digital health technologies a channel for delivering primary health care. And the COVID-19 pandemic is transforming the global health community's acceptance and use of digital health technologies. The need to monitor the data on number of patients with related diagnosis before the first case of a patient with this type of disease is identified. If there are anomalies, then specific action should be taken to identify the cause of this variation. For this reason, technological infrastructures must be fairly organized and shared within nations worldwide and with respect to individual rights. So, COVID 19 has forced many countries to social distancing to prevent the spread of epidemic. Building more robust telemedicine systems in the hospital and communities worldwide is becoming very important. This will reduce the no, yeah. This will reduce at first the pressure on the hospital infrastructures and the resources such as beds and healthcare workers. Then, secondly, those are healthy may stay at home without going to the doctor's office unnecessarily, but receiving assistance as well as needed. And thirdly, the people who are ill but be treated online by qualified physicians without the need of for the special medical equipment may receive prompt and cost effective care and counseling. So, next point, to protect the healthcare workers, the most outrageous failure of many health systems has been and continues to be the inability to adequately protect professionals and healthcare workers. Many thousands of healthcare workers have been infected and died amid the ongoing coronavirus outbreak, a sign of immensely difficult working conditions for doctors, nurses, pre-hospital providers, and healthcare workers in general. They should be they should instead be among those best protected. Recognizing teamwork under stress and possible burnout, promoting effective communication and conflict resolutions, recognizing and training leadership, mental health support were the key behavioral and physiological and elements and that were proven to play an important role in supporting the performance, health, and safety of the healthcare teams. The importance of the effective team dynamics and non-technical skills training and predefined processes and protocols should be highlighted and implemented for facing future crises. To be prepared for mass casualties and during the pandemic. The COVID-19 pandemic has continued to request resources implementations for nearly 2 years. At present and in the last months, the different systems have not shown an adequate capability to face an eventual sudden increase in request, as in a mass casualty scenario. Moreover, millions of diagnoses are missed from the count, meaning that the health system has not been able to guarantee the standard of care, and we were all used to. The effect of the pandemic on population exceeds the simple count of infected, hospitalized, and dead patients. Every day of difficulty is guaranteeing the health standard brought direct consequences on the non-COVID patients. Trauma and acute care services have been involved in the preparedness, planning, and response of the COVID-19 pandemic. During the COVID-19 pandemic, hospital leadership and health providers have faced difficult decisions in critical resource provision and the triage of patients in need to intensive care beds, mechanical ventilation, and extra corporeal membrane oxygenation, that is ECMO. Next, please. The first step to avoid complete rebuckle of the complete health system organization is to understand which manager's level of the care is not negotiable, along with the resources needed to maintain it. Even facing a crisis like a pandemic, there must be always a chance to respond to the mass casualty incident, and this can be allowed by thinking the healthcare facilities and healthcare professionals as a modular system. To this purpose, it is mandatory to shift the decisional chain from an unidirectional one to the bureaucrats providing guidelines to the professionals, where stakeholders and healthcare professionals are used to reciprocal interactions and exchange information, leading to a responsible and complicated decision. This is our last slide. So here we end our presentation. But before we conclude, I would like to add a few more points. As we come to an end of the pandemic, we see that the strict protocols of COVID-19 have been taken off. Like in India, there are the state governments have already started to make the states mask free. On that note, and even in the Philippines, we see that we have not encountered as many cases, and the cases have reduced a lot in the last few months. And we hope and pray that this pandemic ends soon. And with the recent record, we have seen that there have been given in the Philippines, we have the given doses of vaccines are around 149 million, and in India, it's 1.86 billion doses. And the percentage of fully vaccinated people in the Philippines is 60.8%, whereas in India, it's 61.0%. And according to the studies, until the date of April 11, 2022, in the Philippines, the booster doses taken by the citizens are 11.4% of people have already received the booster dose, which is a very nice thing to get to the end of this pandemic, and we hope and pray that this pandemic ends soon and we are all mask free. Thank you so much.
Okay, very relevant topic that you choose for public health lecture. Just advise, if you are going to do it in delay, your visuals, not so much text, bullet point, so it's direct to the point, so people will understand more. Okay. Okay. Good job.
Good morning, Doctora.
Good afternoon. Good morning, Doc Ray.
Good morning, class. I have question for the reporters.
Go ahead, sir.
Yes, ma'am. Okay, based from your readings and also based from the experiences that we have for the past 2 years that we are in the pandemic, what were the fundamental lessons we have learned from the COVID-19 pandemic? And how can we actually move forward from these learnings? Remember that you are actually taking in charge in the next few years as full-fledged doctors, say 3, 4, 5 years, and then you have experienced this pandemic during your lifetime. So what were the learnings or lessons we can learn from the COVID-19 pandemic? Anyone?
Yes, doctor. I would like to answer this. Like
Mhm.
the lessons we learned from the COVID-19 pandemic is actually like initially when the first case was analyzed in Wuhan, there were people didn't know actually how to react to it, and there were not many tests for that, and so people took it lightly as like a common cold disease, and they and it spread. And as as the time grew and we knew that this was not just like it was not a very just a common cold, and it was something severe to it, and until we could find out the causes and what it could like how lethal it was spread all over the world. So in the near future, if we encounter any symptom which is not common, we should take strict action then and there, even if it's only one patient, and we should start acting accordingly with with the first patient itself, and not wait for more patient to get infected.
Okay, very good. So based on what we are actually experiencing right now, we also have to come to realize that a simple measures such as social distancing or putting your mask regularly would actually help in the transmission, no? And also understanding how the disease can actually affect or transmit it. That's actually very important. That's why we are teaching you the nature course of the disease. And what we also learned that telemedicine may also become the new normal. The vaccination works. These are just simple and practical things that we tend to ignore. But this time around, during the pandemic, it was highlighted, right? Okay.
Hello.
Yes.
Doctor, I wanted to add one more point. Actually, during this pandemic, we learned the necessity of the basic health and basic hygiene. We started using face masks and sanitizers regularly during this COVID-19. So I think we should continue with that, because it will add it will be healthy lifestyle if we continue to use this.
Okay. Very good. So it's actually also a personal and an individual initiative, but the effect can also be in the community level, right? So we encourage everyone to take part, but the community involvement or engagement of the community is also very essential. Okay? I think that would be all. Next group, Dr. Dr. Audrey, you have question?
Nothing more. Go ahead
Okay.
for our next group.
Group 11,
Hello. Hello, can you hear me?
Go ahead. We can see your slides.
Okay, doctor. Good morning. My name is Anjana, and this is Group 11. Our topic is about irritable bowel syndrome, also known as IBS. Next slide. Next slide. Next. Introduction. Irritable bowel syndrome is an unpleasant and often debilitating condition that affects mainly the large intestine. It is characterized by frequent, recurrent abdominal pain, as well as problems with constipation and or diarrhea. So these are some of the main points that we know about IBS, but here we'll be talking about how it actually affects the day-to-day lives of the patients. So IBS is not a disease, it's mostly a functional disorder, which means that the bowel doesn't work as it should be. So despite IBS being a non-life-threatening disorder, it causes a lower quality of life compared to the healthy population. Next slide. Some of the key facts about IBS are irritable bowel syndrome is a functional bowel disorder, like I mentioned earlier, which is characterized by abdominal pain or discomfort and altered bowel habits in the absence of detectable structural abnormalities. There's no structural abnormalities associated with this, and there's no clear diagnostic markers as of now for IBS. And irritable bowel syndrome is a hidden public health disease. That is, it's not mostly token, people don't really mention about these diseases, so it's mostly hidden public health disease. And irritable bowel syndrome is a common functional gastrointestinal disorder which is associated with a broad variety of psychological and physical symptoms combined with an impaired quality of life and increased use of healthcare researchers. Next. So mostly patients with IBS, they tend to avoid social settings because they're always, it always seems like a challenge to them, especially going to an unfamiliar place, because they're always worried about locating a bathroom nearby, because unfamiliar places will make them, because these symptoms are mostly unpredictable. They're always in a constant state of uncertainty, which again makes them more anxious. And this can further worsen the patient's symptoms as well, because anxiety and stress, all these all these emotions can be triggering to IBS. And IBS is predominantly seen in the female patients. Next slide. So, what are the causes of IBS? Researchers don't exactly know what causes IBS. This is mostly an idiopathic disease, and they don't really know what is actually wrong in IBS. So there's a combination of factors that everyone thinks that IBS, this is the problem with IBS, like dysmotility, problems with how your GI muscles contract and move the food through the GI tract. So thereby, there's a decreased transit time, and the patient has this constant urge to defecate. And next is a visceral hypersensitivity. That is, this extra sensitive nerves in the GI tract that makes the patient more aware of the spasms in the colon and the large intestine. And brain gut dysfunction. That is, there is a miscommunication between the nerves in the brain and the gut. Next slide. The diagnosis. The diagnosis associated with IBS. IBS is mostly diagnosed by ruling out most of the other diseases. Like, for example, in IBS, there is abdominal pain and there is diarrhea or constipation. So first, we'll be ruling out all the other diseases associated with these symptoms. And then finally, we'll come to IBS. So one of the first step towards diagnosis of IBS is there is improvement with defecation. So this is a very important point. If the patient says that he feels a relief after defecating, then it's definitely pointing us towards IBS. And then second is the onset associated with a change in frequency of the stool. Third is the onset associated with the change in the form, the caliber of the stool. So all of these, along with abdominal pain, we can come to the diagnosis of IBS, and this must go on for at least 3 months, and with symptom onset should be at least 6 months prior to the diagnosis. Next slide. So some of the, we can also diagnose this with flexible sigmoidoscopy. It is an exam used to evaluate the lower part of the large intestine to see if there's any structural abnormalities like lesions, mass, or etc. Next slide. CT scan, CT colonography, also known as virtual colonoscopy, uses low dose radiation CT scanning to obtain an interior view of the colon. Next slide. Colonoscopy is an exam used to detect any changes or abnormalities in the large intestine. And here there's a tube is inserted into the rectum, a flexible tube, and there's a small video camera attached to the tip of the tube. And the doctor will be able to have a more better view inside the entire colon. Next slide. So the clinical features. IBS is a disorder that affects mostly all age group, but mostly we see the symptoms usually begin before the age of 45. So, but all the individuals have a lower reporting frequency, but it is still there. And women are mostly diagnosed with IBS 2 to 3 times more often than men, and make up to 80% of the population with severe IBS. Pain or abdominal discomfort is a key symptom for diagnosis of IBS. Next slide. Okay, abdominal pain. Abdominal pain in IBS is highly variable in intensity and location. It is frequently episodic and crampy, but it may be superimposed on a background of constant ache. Pain may be mild enough to be ignored, or it can be severe enough to affect the day-to-day activities as well. Sleep deprivation is unusual, but it can occur. So it can wake up the patient at night because of the abdominal pain. Next slide. So pain is often exacerbated by eating, especially the certain food that people complain of, especially spicy food can trigger their IBS attack, or emotional triggers, like if they're more stressed, it can also contribute to the patient having an IBS attack. And these are mostly improved by passage of the stools. In addition, female patients with IBS commonly report worsening of the symptoms during premenstrual and menstrual phases. So during the menstrual period, it becomes a lot more worse because they report they're mostly more bloated and they experience more abdominal pain than before. Next slide. Altered bowel habits. Alterations in bowel habits is the most consistent clinical feature in IBS. The most common pattern seen is constipation alternating with diarrhea, because there's like two patterns. Either it can be constipation predominating and then diarrhea can occur occasionally, or it can be diarrhea predominating and constipation occurring alternatively, like in certain occasion. Next. Most patients also experience a sense of incomplete evacuation, thus leading to repeated attempts at defecation in short time span. So some patients say that they feel like they haven't really emptied their bowel, so it leads to repeated attempts at defecation. And since like in our world we already have a set time to everything, because like for at the time we have to go to the class, or at certain time we have our breaks. So these patients find it hard to fit into these timetable because their bowel is not really cooperating. Next slide. So gas and flatulence. Patients with IBS frequently complain of abdominal distension and increased belching of flatulence, all of which they contribute to increased gas. So these all must be very embarrassing, because since early childhood, we've been taught to hide any signs or noises relating to our bowels, and that mostly they say it's shameful to discuss these kind of topics in public. So unfortunately, IBS puts these taboo aspect in front and center in one's life, which can be very exhausting to live with. Next slide. Now we're going to discuss about the mental health. About 60% of IBS patients meets the criteria for one or more psychiatric disorders. The most common mental ailment people with IBS have is generalized anxiety disorder. Like I mentioned earlier, most of the patients, they say is that when they go to an unfamiliar place, the first thing, unfamiliar place or any place, the first thing they always make sure is to locate the bathroom, because they're always thinking about what would go wrong. So they're always anxious all the time. These patients can have mostly have a generalized anxiety disorder, and another 20% have depression, and the rest have other disorders. Strong emotions like stress, anxiety, and depression trigger chemicals in the brain that turn on the pain signals in your gut that may cause your colon to react. So people with IBS often experience a strong urge to use the bathroom most often, and may avoid going to places without easy access to one. So this can really limit their social life, and they always feel like they're not really having fun compared to their friends. Next slide. Next slide. So this means that many everyday locations like going to the mall or parks can feel very risky and challenging, and they might start to limit their activities as a result. People with IBS also start to fear and avoid many food believed to trigger IBS attack, and often leading to the loss of pleasure in eating, as well as reduce opportunities to socialize. So some people even they tend to skip certain meals. They sometimes they tend to avoid at all, because they think that if they don't have their food, they can not be too stressed as to if they have the IBS attack, and if they're especially in a social gathering. So all of these can fuel a vicious cycle of discomfort, anxiety, vigilance, avoidance, and visceral hypersensitivity, in which GI sensations get horribly amplified. So all of these can seem trivial to many of us, but all of these put together on a day-to-day basis can be very exhausting to deal with. Next slide. Athar will be taking over from here. Thank you.
Good morning, everyone. I'm Athar Mehta, and I'll be taking it from here. So the symptoms of the disease are cramp pain in the abdomen, painful diarrhea, mucus in the stool, and swollen or bloated abdomen. As we can see, crampy pain is abdomen is the most common symptom and is seen in 80% of the patients. Next slide. Pathophysiology. The pathophysiology of IBS remains poorly understood, though non-specific certain pathogenic factors, including genetic predisposition, visceral hypersensitivity, food intolerance, altered gut-brain axis, and gut dysmotility, dysfunction of innate immunity, and dysbiosis may contribute to this disorder. It remains unclear which among these pathogenic factors trigger or augment the IBS, as symptoms vary among different individuals. Next. Prevention. So to prevent IBS, it is unavoidable. Symptoms will come and go, but however, we can add some measures to control them. First of all, adding fiber to our diet, as fiber increases the intestinal motility to reduce constipation by creating a bulkier bowel movement, and fiber also decreases intestinal motility in diarrhea by absorbing excess water from the stool. When adding fiber to your diet, do it slowly to allowing your intestines to just adjust. Second, avoid fatty and greasy foods in order to decrease the cholecystokin production. Cholecystokin is a hormone that it is potent stimulus for propulsive contraction of the colon. Also, it aggravates the colon. Third, avoid gastric irritants such as caffeine, alcohol, and nicotine. Fifth, people with IBS often experience cramping. So monitor your own response to specific foods and adjust accordingly. Some people with IBS cannot tolerate certain foods such as broccoli, cauliflower, onion, beans, and cabbage. So just patients with IBS can keep the track of the meals. Sixth, large meals can cause cramping and diarrhea in people with IBS. If this happens to you, try eating 4 or 5 small meals a day, or have usual 3 meals, but eat less at each meal. 7. Keep a food diary in order to find out which foods are easier for you to digest. 8. Do regular exercise to strengthen abdominal muscles. Stronger abdominal muscles are able to handle gas problems. 9th, reduce stress. As mentioned earlier, stress is any stimulation that requires adaptation or change. It affects people in different ways. Recognize the cause. Learn what triggers your stress. Learn different coping skills. Next, breaking the stigma. As my group mate said, that it can be an embarrassing moment for the patients with IBS. IBS differs the most other health conditions in one key: its symptoms and bodily processes that we have been conditioned to think of as embarrassing. Because of our early conditioning, most of those with IBS experience feelings of shame regarding their bowel problems. You may find that it brings out a great sense of relief when you begin to tell others about the health problem that you are struggling with. So, in order to help, we can say that to put the illness in its place. That means concerned about the person with IBS without making illness the primary focus. Second, be flexible. IBS symptoms can flare up at any time without warning. Understand that plans sometimes will need to be changed. Third, avoid laying blame on the person with IBS. Fourth, consider the person with IBS as the expert in charge of his or her condition. Providing an emotional support, a sense of assurance will be much appreciated. Recognize the skills and strengths the person with IBS uses coping with this challenging disorder. Next, treatment. So treatment involves a mix of drugs and diet and psychosocial interventions. Next, first is dietary modification. We can avoid the food that triggers the symptoms. Second is low FODMAP. So FODMAP is fermentable oligosaccharides, disaccharides, monosaccharides, and polyols, which are short chain carbohydrates that are poorly absorbed in small intestines. Fiber supplementation may improve symptoms of constipation and diarrhea. Next, pharmacological therapies are antispasmodics, tricyclic antidepressants, selective serotonin reuptake inhibitors, and probiotics. Next. Conclusion. IBS is a complex disease with pathophysiology that is poorly understood. With its wide array of symptoms ranging from constipation to diarrhea and multiple of possible presentation, a one-size-fits-all approach to treatment is inappropriate for most patients. Instead, the initial treatment approach for IBS should involve non-pharmacologic management and then focus on drug therapy for the individual patient's predominant symptoms according to the limited evidence based medicine supporting specific agents in the treatment of IBS symptomatology. The monitoring, education, and the support of IBS is very important in IBS management. Thank you.
Okay, thank you very much. It was a very comprehensive discussion, although you actually given a lot of information. But next time, if you're going also to do a public health lecture, you also need to take note of who is your target audience? Why are you doing this lecture? It's very important for you to also conceptualize how are you going to have your lecture done or proper approach in doing such. Okay, my question would be basically what is the goal of treatment for IBS patients?
So the basic goal for the treatment of IBS is improving their lifestyle and their uh, daily lifestyle to not feel embarrassing and to go on with their life easily.
So this is actually a symptomatic approach we're in. We also have to base it on the evidence, no? So evidence-based approach can also be given or can also be tried to our patients with IBS. As we've mentioned a while ago, no specific treatment for all patients, but it has to be tailored fit, no? Based on
Yes, doctor.
this.
Yes,
Okay.
doctor. This is mostly a symptomatic approach because not all patients present with the same symptoms. And like other mentioned that one size fits for all cannot be done for IBS. So what all symptoms the patient is being affected, like for example, abdominal pain, or if the patient has diarrhea or constipation, we'll give medications according to that and try to give them counseling as to that this is not something to be embarrassed about, and try to make their life more better,
Okay, so
because
development of your
this is
evidence-based.
something.
Go ahead.
No, doctor, because this is something that they have to live with their whole life, because this is not curable. So early on, they should be given counseling and made the patient aware that there's nothing wrong about being embarrassed, or they should stop being embarrassed, and there's nothing wrong with them.
So it's a matter of a trial and error approach as well, right?
Yes, doctor. And
So
the fact that
development, this is what basically the development of your evidence-based guidelines on a stepwise. Okay, you started from the first, and then you try to shift to another one modality, and this is a symptom-based approach, no? Especially if you are going to diagnose your IBS. Okay, okay. Dr. Andres.
Well, bowels are one of the more neglected part. We just take it for granted. But remember, if we're constipated or we're having loose bowel movement, it ruins our day. So it's very important. And sometimes you take it as a matter of fact. Ah, I had loose bowel movement. Oh, I haven't had bowel movement since 3 days ago. And you just take it, oh, it will come. But remember, it's one of the first signs that something's wrong in anything, in any system. Okay? Neurological, it's affected, right? Of course, if it's gastric, if you're pregnant, it's affected. So it's affected by a lot of conditions. So it's important that our bowels, not only irritable bowel syndrome, we take note of. Okay? Next group.
thank you, doctor.
The reporters or the group that's reporting, could you open your camera so we could see you?
Um, Hello, doctor. This is Group 12, and our topic today is nutrition as public health issue. So let's understand first what is public health. The concept of public health refers to the collective action taken by the society to protect and promote the health of the whole population. What is nutrition? Basically, it is the process of absorbing nutrients from the food we eat and utilizing it for maintaining a healthy lifestyle. Next slide. What is public health nutrition? These are the different definitions given by different authors, but we can summarize them as public health nutrition is a field of study that is concerned with promotion of good health through prevention of nutrition related illnesses or problems in the population and the government policies and programs that are aimed at solving these problems. Next slide. Public health nutrition. It strives to improve or maintain optimum nutritional health of the whole population, and this may include therapeutic and rehabilitative services when these needs are not adequately addressed by other parts of the healthcare system. Next slide. Public health nutrition, it uses multiple coordinated strategies to reach and influence the community and organizations and individuals that make up the community. It requires organized and integrated community nutrition with the efforts by the whole community and the leadership provided by the state and local health agencies. Next slide. Importance of public health nutrition. Dietary factors are associated with 5 of the 10 leading causes of death. The maternal and child nutrition sets the stages for life. The vulnerable subgroups are at high risk. Hence, the goal of public health nutrition is to improve and provide adequate nutrition for all. Next slide. So the core responsibilities of public health. Any professional in the field of public health nutrition has the core responsibility to promote good nutrition and to prevent nutritional problems, for which it is important to do assessment, that is, identify the problem and its magnitude, understand how and why these problems occur, and then accordingly he has to carry out appropriate policy development as well as plan strategies and actions to implement them, and finally to do assurance by evaluating the public health policies and their impact on the public health. Next slide. So the assessment that we have done is like problems that we are currently facing in our country as well as in the Southeast Asia region. There are n number of problems, but we'll list a few over here. Like one is iron deficiency or nutritional anemia. Basically, this is due to inadequate or poor absorption of iron, low iron intake coupled with other infections. And according to the NIN data, the 56% school children and among 50% of the expectant mothers suffer from this problem. Next slide. Other problem is vitamin A deficiency. Basically, children suffer from nutritional blindness due to deficiency of vitamin A. And according to the data, around 60,000 children become blind every year due to this deficiency, among which the toll is highest among the slum children, which is 7.8%, followed by the industrial labor, which is 6.3%, the middle income group, which is 4.7%, and the low income group, which is 4.1%. Next slide. Another important concern is of protein energy malnutrition. This includes kwashiorkor, marasmus, and it is the most widespread form of malnutrition among preschool children. And according to the data, 43.8% children suffer from moderate degrees of PEM, and 8.7% suffer from extreme forms of malnutrition. And almost every state in our country has this problem. Next slide. So what are the factors causing nutritional problem in India? There are a lot to deal with, but I'll like to mention a few, like the socio-economic factor, like poverty, low income, and socially deprived people do not get adequate food. Infection is also a cause. The feeding habits. Basically, not everyone is aware about the proper balanced diet. So lack of awareness regarding good quantity as well as quality of food, which leads to nutritional problems. Next is inadequate distribution of food, like gender inequalities. Also, I would like to mention over here that in the socioeconomic strata, the poor suffer from malnutrition as they do not get adequate supply of food. But the people who are rich, they also suffer from nutritional problem, like they suffer from obesity since they follow more Western diet. So that's also a concern. Then the next factor is rapid succession of pregnancy, poor quality of nourishing, which is poor sanitation, poor water supply, lack of balanced diet, heavy work, and so on. Next slide. Nutritional education. This is important as nutritional quality of people can be educated on the nutritional quality of common foods, the importance and nutritional quality of various locally available, culturally accepted low-cost foods. Importance of exclusive breastfeeding. There are many misconceptions in rural as well as in modern society regarding breastfeeding. So every mother has to be educated on this, that the child must be breastfed up to 2 years or beyond. Damage caused by irrational beliefs and cultural practices of feeding. Like in our country, there are many religions or many cultures that prohibit certain kind of food. So the community is basically deprived of this nutrients, and we can provide recipes for preparing proper food with good supplementary nutrients. Next slide. We can educate the community about importance of including milk, egg, meats, or pulses in sufficient or balanced quantities in the diet to enhance the net dietary protein value. Importance of feeding children and adults during illness, as most of us, like when we are ill, we do not feel like eating, or we are so stressed out. But it's important that we take proper balanced nutrients. Importance and advantage of growing a kitchen garden, and importance of immunizing the children and following proper sanitation. Next slide. Early detection of malnutrition and intervention. This will be carried by Dhairya. Thank you.
Am I audible?
Yes, go
Yes,
ahead.
Dhairya.
Okay. I hope I'm visible too. Now, we'll talk about early detection of malnutrition. Now, first of all, one very important thing that we have to know beforehand, that is that whenever we talk about public health, it contains the word health. And for a healthy body, nutrition is very important. Now, when we talk about early detection of malnutrition, the important thing is velocity of growth, not the actual weight of a person at a given time, person or usually a child at a given time. Because if the growth of the child is slowed or arrested, as shown by flat curve on the growth card, then the physician should be alerted for any infection or any other nutritional deficiency. Now, if the growth chart is not maintained, then we can go with other parameters like weight, height, mid-arm circumference, and all that. When we talk about, this is very important, community malnutrition universal screening tool. In this, we go for step 1, which is the BMI score. We calculate the BMI of a person. Then we go with weight loss score. Then we add it to the acute disease effect score. Now, these are all the parameters. When we calculate them, then we go to a step 4, which is overall risk management. Now we add these scores, and 0 is risk, low risk, 1 is medium risk, and second is more high risk. This is very important in community medicine because with the help of this, we can come to management modalities, which is low risk, routine clinical care we can give, for medium risk, observe, and for high risk, then we can give treatment. So with the help of this chart, it becomes very helpful to access the malnutrition on a universal screening tool. Now we talk about an ideal diet in the pyramidon or diet pyramid, which is often seen. We can see that every day, one thing which we ignore is physical exercise. So every day, what is important is physical exercise. Then another thing that is very important every day is the consumption of vegetables, fruits, whole grains, olive oils, beans. Then at least twice a week, we should go for fish and seafood because there are also important nutrients that we get from them. Weekly in moderate portions, we would go for poultry, eggs, cheese, but it should be in moderate. Then less often we should go for meats and sweets because they are not that good for our body. Water every day, very important, water every day. Then we go for, in moderation, you can have alcohol, or which is here the example that given is wine, but don't forget the word moderation. Now we move forward and we go to the plan. Now, this is basically a plan given by our Indian government for the management of National Nutrition Mission. It is called as Poshan Abhiyan. It is a Government of India's flagship program at improving nutritional outcome for children. It directs the attention of the country towards the problem of malnutrition and addresses it in a mission mode. When the government is complying so nicely, then the effects are also good because it is a whole program scheme. Now, not just that, there is Anganwadi services. Now, when we talk about Anganwadi, it is a very prevalent system in India in which there are women workers who are employed for assessing various kind of activities related to public health, which one of which is also nutritional status. And not just that, these Pradhan Mantri Matru Vandana Yojana and then the scheme for adults and girls. The thing is that when we talk about nutrition deficits in our country, it is not only because of lower or higher incomes, but it is also based on gender. Because in rural areas in India, till date, there are practices where the boy or the male child is fed nicely, whereas the girl child is not. So it becomes the duty of the government to intervene and remove this bias because of gender and create programs and schemes, especially for women and girl child as well. That's why the primary goal of Poshan is to improve the nutritional status, not just of children of 0 to 6 age, which is boys and girls, but adults and girls who are not given that kind of importance. Pregnant women, surely, because a healthy mother will be responsible for a healthy child. So that's why that covers that as well. Now, reading a food label, it is very important. Whenever you buy something related to public health, you have to be sure about reading all these informations. You start here where it's written. Serving one size cup to know about what serving is there. Limit these nutrients, total fat, cholesterol, sodium. These nutrients are not that good for you. Saturated and trans fat is the worst of all. So limit them as much as possible. Get enough of these nutrients, which is vitamin A, vitamin C, calcium, and iron. And then we can see that we have to divide them to 5% EV, 5% or less. 20% or more is high, so you should take care of all these. Always read a label whenever you're buying something. Trust me, you will avoid eating eating things which are not good for your health. Because once when you read it, you realize that if this particular thing has trans fat of 1.5 gram or 3 grams, which is not at all healthy for you, then there are chances you avoid. But if you don't read it, you won't know it, you won't avoid it. Now, nutritional needs of different groups. This is a chart. You can, when we'll share the PPT with the class group, we can have a look at it. These are basic nutritional needs for different groups. Have a look at it. And there's nothing to explain in it. Fruits, vegetables, grains, meats and beans, and all these categories are given. And according to that, the different nutritional needs are discussed. If these needs are followed, we can reach the goal of good nutrition in public health. Eating well in the dining hall, these are basic habits that one should know while eating, like choose lean meats, grilled chicken, other than red meat, hit the salad bar, eat more salads, get creative, choose baked potato with salsa. Like these are the modifications that you can do in your nutritional preferences so that you can reach to a healthy outcome. Thank you. That's all from Group 12.
Okay, thank you.
Thank you.
Very vast topic. Okay. You could have concentrated the more common ones for public health importance, but you have basically tackled the importance of nutrition. One of the, again, also neglected aspects of health is what we eat. More so for Filipinos compared to Indians. I know you are vegans. Maybe target what are the nutritional deficiencies for vegetarians. So there are some nutrients that you lack if you do not eat animal protein, something like that. So again, as Dr. Navarro will say, it will depend always on your audience. So whenever you do talks, we do not give out general information. You weed out the information so that it would be appropriate to your audience. Okay, Dr. El Rey?
Yes, ma'am. I just have some few questions to the reporter. What is basically the relationship between public health and nutrition?
Doctor, the important thing that I like to address is that public health and nutrition are very much, I think they are like dwindled, because we talk about health, as I said, the word health comes in, and for a person to be healthy or the society to be healthy as a whole, nutrition plays a very important role. If the public is not healthy, if there is not enough nutrition, then the public will be healthy enough to compromise, to create a very dynamic and social society.
Okay. Okay, you have also mentioned some measures taken or policy or probably steps or approaches on how to going to improve the nutrition. But in developing countries such as India and the Philippines, what are the major nutritional problems that we actually facing right now?
Doctor, when we talk about countries like India and Philippines, the major problems basically either can be your protein energy malnutrition, in which there is a lack of protein in the diet, PEM and PM, and these all deficiencies which are being faced in basically the lower or the slum areas, in which either their diet is very much high in a particular nutrient, or they don't get enough food at all. So that's why these are two kinds of nutritional deficiencies, where either you'll see kids that they're either obese because they're having just one particular nutrient in their diet. That is, for example, we can say in Philippines, we can see that some kids are only eating rice all the time, right? And not getting other kind of nutrients. So that is a problem. And because the diet should always be balanced. And in countries like India, we can see that in many rural parts, they don't have anything to eat at all. So that makes them very much deficient in almost all the nutrients possible. So they become fragile, weak, and they eventually become morbid and die because of starvation.
Okay, very good. So realizing that there are still existing major nutritional problems in our countries, and this could actually have an effect on the not just the development of our children, but also looking into the maternal nutritional status as well. So it would reflect also the public health initiatives by the government, right?
Yes, Rob.
Looking into these parameters, and that is basically one of the why is the essential or important for us to know about nutritional health, nutritional public nutritional health. Okay, thank you.
Thank you, Rob.
All right, next group. Okay, next group.
Next group, please.
Yes, doctor.
Morning, doctors. This is group number 13. So our topic is diabetes. Next slide. Diabetes is a chronic disease that occurs either when the pancreas does not produce enough insulin or when the body cannot effectively use the insulin it produces. Insulin is a hormone that regulates blood sugar. Hyperglycemia or raised blood sugar is a common effect of uncontrolled diabetes and over time leads to serious damage to many of body's systems, especially the nerves and the blood vessels. The number of people with diabetes rose from 108 million in 1980 to 422 million in 2014. Prevalence has been rising more rapidly in low and middle income countries than in high income countries. Between 2000 and 2016, there was a 5% increase in premature mortality from diabetes. In 2019, diabetes was the ninth leading cause of death, with an estimated 1.5 million deaths directly caused by diabetes. Next slide. The main symptoms of diabetes. So we have this central, from the central, we have the polydipsia, polyphagia, lethargy, stupor. For the breath, we have smell of acetone, the eye, the blurred vision, the gastric, urinary, and the systemic. Next slide. Type 2 diabetes. Type 2 diabetes, formerly called non-insulin dependent or adult onset, results from the body ineffective use of insulin. More than 95% of people with diabetes have type 2 diabetes. Symptoms may be similar to those of type 1 diabetes, but are often less marked. As a result, the disease may be diagnosed several years after onset, after complications have already arisen. This type of diabetes was seen only in adults, but it is now also occurring increasingly frequently in children. Diet and exercise can help some people manage type 2 diabetes. If lifestyle changes aren't enough to lower your blood sugar, you'll need to take medications. Then we have a table for type 2 diabetes, the types of drug, how they work, and examples. The first one, we have the alpha glucosidase inhibitors. They slow your body's breakdown of sugars and starchy foods. For example, we have acarbose, precose, and miglitol glycate. The second is biguanides, reduce the amount of glucose your liver makes, metformin. DPP4 inhibitors improve your blood sugar without making it drop too low. Linagliptin, Tradjenta, saxagliptin, Onglyza, and sitagliptin. Glucagon-like peptides change the way your body produces insulin. Dulaglutide, Trulicity, exenatide, beta, liraglutide, Victoza. Maglanotides stimulate your pancreas to release more insulin. Netiglenide, Starlix, and Repaglenide. SGLT2 inhibitors release more glucose into the urine. Canagliflozin, Invokana, and dapagliflozin, Prexia. Then we have the type 1 diabetes. Type 1 diabetes, previously known as insulin dependent juvenile or childhood onset, is characterized by deficient insulin production and requires daily administration of insulin. In 2017, there were 9 million people with type 1 diabetes. The majority of them live in high income countries. Neither its cause nor the means to prevent it are known. Symptoms include excessive excretion of urine, the polyuria, thirst, polydipsia, constant hunger, weight loss, vision changes, and fatigue. These symptoms may occur suddenly. Then we have the gestational diabetes. Gestational diabetes is hyperglycemia with blood glucose values above normal but below those diagnostic of diabetes. Gestational diabetes occurs during pregnancy. Women with gestational diabetes are at an increased risk of complication during pregnancy and a delivery. These women and possibly their children are also at increased risk of type 2 diabetes in future. Gestational diabetes is diagnosed through prenatal screening rather than through reported symptoms. Then we have the impaired glucose tolerance. Impaired glucose tolerance or impaired fasting glycemia are intermediate conditions in the transition between normality and diabetes. People with IGT or IFG are at high risk of progressing to type 2 diabetes, although this is not inevitable. Then we have the WHO classification of diabetes. Ideally, a single classification system for diabetes would facilitate three primary purposes: clinical care, etiology, and epidemiology. However, this is not possible with our current state of knowledge and resources available in most countries throughout the world. Expert group considered it best to define a classification system that prioritizes clinical care and help health professionals choose appropriate treatments and whether or not to start the treatment with insulin, particularly at the time of diagnosis. The only classification system which could currently go somewhere towards achieving this is one based on clinical parameters to identify diabetes subtypes. Some countries and clinical or research centers can supplement this approach with specific additional investigations, but these are not universally available, and a classification system which relied on these measures would have limited global applicability. Then we have the WHO classification of diabetes. So types of diabetes: type 1 diabetes, type 2 diabetes. Then we have the hybrid forms of diabetes, slowly evolving immune mediated diabetes of adults, ketosis prone type 2 diabetes. Other specific diabetes, we have monogenic diabetes. In monogenic, we have monogenic defect of beta cell and monogenic defect in insulin action, disease of the exocrine pancreas, endocrine disorders, drug or chemical induced infections, uncommon specific forms of mediated diabetes, immune mediated diabetes, and other genetic syndromes sometimes associated with diabetes. Thank you. We have next presenter.
Uh, Good morning, doctors. As our previous reporter described about what is diabetes and the symptoms and what are the treatment and classification according to the World Health Organization. As we know, it is a vast topic, but we try to, as due to the time limitation, we try to, as much as possible, the information is given. So now I will be discussing why we will be taking the type 2 diabetes. As already discussed, it is the most common and prevalence in the more urban countries. So why type 2 diabetes is increasing? As we already seen the data, it has been increasing year by year, and specifically in the urban areas, when specifically in India, like when aging of the population and increased incidence due to urbanization, as already mentioned, in the developing countries, in Philippines too, but in India it's way more, because 11.2% of the total population is been affecting every time affected with the diabetes. And the more sedentary lifestyle, like lazy, and especially in now times as everything is been online, so we can expect more this kind of lifestyle, but not to, but we should have an active lifestyle. Workout should be the mandatory in every steps of life. So food consumption pattern is also be impactful, like more food with high fat content and more refined carbohydrate. And now coming into the what are the direct cost of the diabetes? Like, as we know that the prevalence is increasing, the population are also increasing, so it has directly proportional, like direct cost to the individual and their family include medical claims, drugs, insulin, and other supplies, where the direct cost to the healthcare sector include hospital services, physician services, and overall direct healthcare cost of diabetes range from 2.5 to 15% of annual income. That's like so it's a film budget, like 2.5 to 15% is already been spent annually on the diabetes of the. So depending on the local diabetes prevalence and the sophistication of the treatment available, this annual health budget has been set. And how the indirect cost, even though we are expenditure is more, and there are also some indirect costs, like especially in terms of the, like if the person having any sickness or absence, his productivity usually decreases. So like the person, if it is any amputation and if the stage has progressed, and he's if he's serving any paramilitary or military like that, that doesn't allow the handicap or person. So that premature retirement or premature mortality can be also caused, as already discussed by the reporters earlier. The premature mortality is also been increasing day by day, and also can, these all can have a direct cost. on the productivity, and estimating the cost to society of this loss of productivity is not easy. And pain, anxiety, inconvenience, and the other factor which decrease the quality of life are intangible costs which are just heavy. So what are the health impacts? Like over time, diabetes can damage the heart, blood vessel, eye, kidney, and nerves. And adults with diabetes have 2 to 3 fold increase in of the heart attack and stroke, especially in India, when usually it's very helpful if we find it in a pre-diabetes stage. But especially in India, when a person, usually the adult onset one, that the adult group of India, like the type 2 diabetes one, when they're in a pre-diabetic, they don't know that they are in a pre-diabetic state or not. So that's why proper education in every sector should be given of this, and how to have a proper lifestyle also, even though they don't know, even though they have a pre-diabetic condition, if they maintain a proper lifestyle, they can tackle that. So that's why the adults with diabetes have a 2 to 3 fold increase of the heart attack and stroke, because it's already been a chronic state. So combined with the reduced blood flow, neuropathy, as already mentioned, so and in the feet increases the chance of the foot ulcer and eventually need for limb amputation. So diabetic retinopathy in a important cause of the blindness and occur as a result of the long-term accumulated damage to small blood vessel in the retina. And close to 1 million people are blind due to diabetes. Diabetes is among the leading cause of kidney failure. As we can see how this can affect all other organs. So it is very much crucial for an adult group, especially because it's more common in the adult group. So it is very important to have a symptom. What are the early symptoms? Like if the person is having sitting, suddenly he's having blurry kind of vision, hypertension, regular headache, and frequent feeling of drinking water. That's kind of the symptom. Specific that proper education should be given. And the facts on prevention diabetes, as mentioned earlier, the heavy social and economic cost of type 2 diabetes, as is already common, including its role in other diseases such as heart disease and stroke, mean that primary prevention is most priority. So before progression or from pre-diabetic to diabetic, so primary prevention should be in priority, like protect what primary prevention is: protect susceptible individual from developing diabetes. It has an impact by reducing or delaying both the need for diabetes care and the need to treat diabetic complication. That's important because it usually have a direct and as well indirect effect. So secondary prevention include early detection. That's also a part of in every sector should be there. Early detection, whether a person have or not, whether it's a pre-diabetic condition or not, and the prevention and treatment. Appropriate action taken at the right time is beneficial in terms of quality of the life and is cost effective, especially if it can prevent hospital admission. And pre-diabetic can prevent the development of type 2 diabetes by making change in the lifestyle, as I mentioned earlier too. And effective prevention also means more cost-effective healthcare. Yeah, it is when already we are preventing, it can reduce our direct cost. So, and also prevention, achieve and maintain a healthy body weight. It's important whether the patient is obese is a major risk factor of insulin resistance. So be physically active. What are the guidelines? It's to be physical active, doing at least 30 minutes of regular moderate intensity activity on most days. And more activities required for weight control. Eat a healthy diet, avoiding sugar and saturated fats, and avoid tobacco. Tobacco, like smoking, usually it's been found increases the risk of diabetes and cardiovascular disease. Whereas the diabetic diagnosis, anyone who has a symptom of diabetes or is at risk for the disease should be tested. As I already mentioned, before progression or having any complication, it's always crucial to detect in an early stage. Because a person can lead a normal life if it's detected in early. It's always a myth that whether the patient is in a pre-diabetic, he will develop diabetes. No, it's not like that. So women are routinely tested for gestational diabetes during the second or third trimester of the pregnancy. And how the doctor used to diagnose pre-diabetes and diabetes with the help of F, FPG, like fasting plasma glucose test, measure your blood sugar after you have fasted for 8 hours. And the A1C, also hemoglobin test, provide a snapshot of the blood sugar level over the previous 3 months, which is I think usually should be less than 6.7. And to diagnose gestational diabetes, your doctor will test your blood sugar level between 24th, as already mentioned, 24th to 28th week of your pregnancy. And during glucose challenge test, your blood sugar is checked an hour after you drink the sugar drink. During the third hour glucose tolerance test, your blood sugar is checked after you fast overnight and then drink a sugar liquid. In early stage, diabetes may or may not cause many symptoms, but usually with little progression, there is some addition of symptoms there. So you should get tested if you experience any of the early symptoms that do sometime occur, including like being extremely thirsty, as I already mentioned earlier, like feeling tired all the time, feeling very hungry, even after just had a meal before, still feeling hungry and having blurry vision, urinating more often than using, having scores or cut off that won't heal. Also, yeah, if there is any wound that usually don't recover, it's the main symptom of diabetes. And some people should be tested for diabetes even if they are not experiencing symptom, because it is not in that progressive state. So according to ADA, recommends that you undergo diabetes testing if you are overweight, because it's as I already mentioned, it's a major risk factor and fall into any of the following category, like high risk ethnicity. Usually the risk factor like race of African American and Native American and all other Asian Americans are very high in this. And if the patient is very hypertensive and high triglyceride level, like obese person, low HDL cholesterol or heart disease, and if the person have a history of diabetes and personal history of abnormal sugar level or sign of the insulin resistance, not engaging in regular physical activity, and also you are women with a history of polycystic ovary syndrome or gestational diabetes. What are the treatments of diabetes involving, like basically in a pre-diabetic or the common, like the common basic prevention or treatment you can say is the having a proper lifestyle, like modification of food and having as in place of having sedentary lifestyle, you can have an active proper workout, active lifestyle, walking at least 30 minutes for a day. Even that it's not enough, but still it can improve. And lowering of the blood sugar, also having a low food sugar will also help to lower the risk. And tobacco is, like already mentioned, smoking can also aggravate it. So interventions that are both cost saving and feasible in low and middle income countries, especially like here, and blood glucose control, particularly in type 1. People with type 1 diabetes require insulin. So people with type 2 diabetes can be treated with oral medication, but may require insulin when, because at later stage it's been found that even though it is a resistant type, but later the pancreas is not able to secrete insulin. So blood pressure control, foot care should be seen to avoid amputation, and in screening and treatment for retinopathy to avoid permanent vision loss, and blood lipid control and screening for early sign of diabetes related kidney and treatment. What are the WHO responses? Provide scientific guidelines for prevention of major non-communicable diseases, including diabetes. Develop norms and standards for diabetes diagnosis and care. Build awareness on the global epidemic of diabetes. So, who is always trying to build awareness? So it's also our role is there to have acknowledge that. So that's why we always celebrate World Diabetes Day on 14 November. and conduct surveillance of the diabetes and its risk factor. In April 2021, we launched the Global Diabetic Compact, a global initiative aiming for sustained improvement in diabetes prevention and care, with a particular focus on supporting low and middle income countries. Whereas in the May 21, the World Health Assembly agreed a resolution on strengthening the prevention and control of diabetes. So what are the recommendations? Change will come easily if everyone is involved, as already mentioned, in every sector, not in individual level, also in private, also in government level. So local government level too. And prevention diabetes can be on different level, individually, community, local, government and national level. Parents of overweight children should be helped to take responsibility and encourage healthy eating and physical activity. And anti-smoking behavior should be promoted by implementing legal action. Governments should work to reduce health inequality and improve the environmental factor by improving the deprived area and controlling safety and making the streets safe for walking or cycling to school or the workplace, promoting improved access to sport, leisure facilities, as well as encouraging physical activity. Now, the government in India is also taking some initiative in this, as every having a yoga, and also they're putting some kind of activities there. They're finding time for that. So this is what to find the awareness World Diabetes Day. Thank you.
Okay. So diabetes is very prevalent and has a lot of end organ damage. Okay. So that you could catch tips on how you could catch, especially if it's for the layperson. These are the things that could happen if you do not take care of your diabetes, or if you do not know that you have your diabetes. You know that diabetes can be prevented by lifestyle change or early detection. You prevent the comorbidities. Okay. Next group, Dr. El Rey, are you there? Okay, next
Yes, ma'am. Nothing. Yes, ma'am. Nothing from my side. Thank you.
Comprehensive.
Yes.
Okay, go ahead. Next group, we still have 6 more groups. So please,
Yes, doctor.
on what's important, just showcase your whole and do not read everything. Just showcase what's important with your lecture so that we could fit everyone. Okay, go ahead.
Doctor, am I audible? Hello. Am I audible, doctor?
Yes, we can hear you.
So morning, everyone. This is group 14 with our public health presentation for obesity. So basically, what is obesity? So person who has BMI more than 30 or 29.9, that person can be called obese. Obesity defined by abnormal or excessive fat accumulation, which present with the risk of health. And as I already considered, a BMI over 30 is obese. And it's not just a cosmetic concern, but it's a medical problem that increase such health problems like heart disease, diabetes, high BP, and heart disease like coronary artery disease, congestive heart failure, and also in diabetes, it can cause central obesity, which is more we can see in females, which is also part of Cushing's syndrome. Also, it equivalent to increased body weight need not to be the case. Lean but very muscular individuals may be overweight by numerical standards without having increased adiposity. So yes, bodybuilders with lots of muscle and very little fat could easily have BMI in obese category. So we can conclude that example as our overweight by numerical like in muscular individuals obesity. Next is prevalence. So data from HANES shows the percentage of American adult population with obesity who have BMI more than 30 has increased from more than 14% between 1976 and 1980 to more than 37% between the year 2014. So extreme obesity, those person who have BMI more than 40 has also increased, which affects more than 5% of the.
No audio.
What happened? Hello?
Doctor, I think his net is disconnected.
Someone else from the group continue. Could someone else from the group continue while your classmates disconnected?
Doctor, just a minute. He's fixing the network issue.
Can we go back to you? Can we have the next group? Is the next group ready?
Yes, doctor, we are ready.
Fix obesity first. Okay? We'll have the next group first.
Doctor, can I continue?
Are you ready? Continue.
Okay. So where are we? Okay, so prevalence. So I was talking about the high income countries. So overweight and obesity are not dramatically on the rise in the low and middle income countries, particular in urban settings. Like I was talking about high income countries like Germany, US, Japan, and Canada. The middle income countries like Russia, China, India, and Brazil, as well as Philippines, can be concluded as middle income countries. And the low, if you are talking about then Nepal, Togo, Sudan, Afghanistan, and Bangladesh can be concluded as low income countries. So the rate of increase has been more than 30% higher in developing countries than that is in developed countries. So yes, the developing countries like India, I already talk about like China and Brazil. So next, if we are talking about most obese country in 2022, so yes, the top 5 countries are Nauru, the Cook Island, Palau, and Marshall Islands. In Nauru, if we are talking about the obese people, the percentage are more higher according to the population. It is like Nauru, you can find it is the Oceania continent, which is near in the South Pacific zone or somewhere in between. It is a small island where the population is more than 70% of the population is obese in this country, which is due to the phosphate mining, which was done in the in 20th in 20th or 19th century, and the phosphate is the main concern, and also the Western foods from which are targeted for the alcohol and guns. Because the European countries are very much familiar to take guns and alcohol from Nauru. In in return, they give Western foods and all to them, which is a cause of obese in that country. So prevalence in India. So India ranked third most obese country in world in 2019. The prevalence more than 40% with zonal variation, with South India highest at more than 46% and East India at more than 32%. Obesity is higher among women more than men in India. It is also higher in urban than rural areas. It is higher in people over 40 than under 40. It is also higher in educated people, more than 44% who are in college, than uneducated people. Because if we are talking about educated people, so most of them we can find in the urban areas. So they can be called as sedimentary people, because means the people who spend much of their time in seated like office, company employees and managers and all. And if I'm talking about uneducated people, mostly we can find in rural areas like the farmers, and they are in rigorous physical activity like that. So it is also higher in people with low physical activity and then the vigorously active people. Okay, so physical activity. So those person who can't able to do exercise, and also we can find them obese in India. So causes, what are the causes? Genetics, physical activity, diet, height in carbohydrates, overeating, frequency of eating, medications, psychological factors, disease, and social issues. So genetics, weight is also dependent upon genetic. For example, one genetic cause of obesity is leptin deficiency. This is a hormone that controls the body weight. And the physical inactivity, like I already talked about, the sedentary people burn fewer calories than people who are active. So yes, the sedentary people who are mostly seated, die high in carbohydrates. So carbohydrate increase blood glucose level, which in turn stimulate insulin release by the pancreas, which promotes the growth of fat tissue and also cause weight gain. Overeating, yes, overeating leads to weight gain, especially when the diet high in fats. In India, we can see the diet high in fats because the street food and all are like much oilier than if I compare to the Philippines. So we can relate it with that. Frequency of eating, there are so many reports, overweight people eating less often than the normal weight. Medications like antidepressants, diabetic medications, OCP, corticosteroids, high BP medications, and antihistamines can cause obesity. Psychological factors like sadness, stress, anger, influence eating habits, and boredom. So we can see like the psychological factors are more in female than in men. Disease like hypothyroidism, Cushing syndrome. I already gave this example of Cushing syndrome, and Prader-Williams syndrome also cause the obesity. Social issues, lack of money to purchase healthy food or lack of safe places to walk or exercise can increase the risk of obesity. Okay, so social issues, if I'm talking about India, so I can relate with that because the person who can't afford to buy a good food can get obese because they eat such street food like oily food, like in India we can call chips and like samosa and kachori, like that stuff. In India we call like that. So yes, they can get which is very deeply fried, and the cost is also minimal, so they eat and get obese with a period of time. Complications of obesity, insulin resistance, the insulin resistant than muscle cells before. Obesity is one more important cause of insulin resistance. Type 2 diabetes mellitus, which is central obesity. I already gave the example of Cushing syndrome, which the fat accumulates around the waist, which is more in women than men. Hypertension, weight gain tend to increase BP in women more significantly. And high cholesterol, obesity increase high amount of triglycerides and turn into high cholesterol. Stroke like CVA, obesity increase high blood pressure, which in turn could lead to stroke, which block some. So stroke is like reduced blood supply to the brain. Others are heart attack. Obese patients have the risk of developing coronary artery disease, congestive heart failure due to fat predisposition or other myocardial or hemodynamic changes. Cancer. Obesity is a risk factor for cancer like colon, rectum, prostate, gallbladder, uterus, breast. Sleep apnea due to fat deposits in airway with decreased muscle activity. Arthritis. Excess weight puts added stress on joints, causing pain and worsening arthritis damage. So next, Siddhi will continue.
Good morning, doctor. So next is, how do we know that a person is obese or not? So this can be calculated by BMI, which is body mass index, and it contains the person's weight divided by the square of height in meters. So the normal BMI is the range is from 18 to 25. So if a person is more than 25 or 24.9, it is the person is already called overweight. And then if the class 1 BMI is more than 30 to less than 35, it is class 1 obesity. The class 2 obesity is 35 to less than 40 BMI, and the class 3 BMI is 40 or higher than 40. It is the severe obesity. Next slide. Again, for the children and teens, it is different because the BMI here is age and sex specific. Rather, in our age or in adulthood, it was height and weight specific. So it is often referred to as BMI for age. BMI levels among children and teens need to be expressed relative to other children of same sex and age. So there's this example of 10-year-old boy whose average height is 56 inch and his weight is 102 pounds and will have a BMI of 22.9, which for his age and his sex is much more greater. This would place the boy in 95th percentile for BMI, and he would be considered as having obesity. This means that the child's BMI is greater than BMI of 95% of all the 10-year-old boys in reference to the population. How can overweight and obesity be reduced? So there are certain measures or certain things we can change in our lifestyle. So overweight and obesity, as well as the related non-communicable diseases, are largely preventable. Supportive environments, communities are fundamental in shaping people's choices by making the choice of healthier foods and regular physical activity. This is the easiest choice we can choose, and therefore preventing overweight and obesity. At individual level, people can limit energy intake from total fats and sugars, increase consumption of fruit and vegetables, as well as legumes, whole grains, nuts, pulses, and engage in regular physical activity. For children, it should be 60 minutes a day, and for adults, it is 150 minutes spread throughout the week. In an emerging health crisis in India. So in India, it is like there is so much of street food, which is not healthy. It's healthy, but not healthy if you take in moderate, if you take in severe amount. Like moderate amount is okay, because in India, there is less amount of physical exercise these days. As it is a developing country, people are more towards working and less towards taking care of their physical health, also mental health. In first months of COVID pandemic, obesity rates among children jumped substantially according to latest National Family Health Survey. The number of overweight children increased from 2.1% to 3.4%. The percentage of overweight women went from 20.6 to 24, while in the men it increased from 19% to 23%. Obesity during pandemic could be due to lower levels of physical exercise and increased screen time, diet quality, and greater frequency of eating. So in COVID, what actually happened was people were not able to go out. They were not able to do physical exercise like walking, jogging, because it was not allowed to go out. So it was like there were so many recipes all over going on the internet. People were very fond of it, and then they start. It was overeating basically because there was no work in initial months of COVID. There was no work from home or anything, so people were tend to more towards eating, pastime eating, or out of boredom they were eating. Then it was playing on the screen, game, movies, increased screen time. So it led to obesity or overeating. Next slide. Some of the programs that can help tackle obesity: create breastfeeding friendly communities. To establish breastfeeding friendly coordinated community support networks for families from pregnancy through infancy to increase breastfeeding initiation. Hunger prevention and nutrition assistance, to provide nutritious foods like low fat milk, fresh produce, and whole grain cereals to those in need. Improve access to fruits and vegetables using nutrition education workshops, economic strategies to make fruits and vegetables easily available to all the sectors of the population. So we can see that there are packet foods all over and which can be easily accessed, like for 5 peso, 10 peso, or in India 5 rupees, 15 rupees. So it's easily accessible. People don't read the nutrient content behind it, the calorie it gives, the protein, the fats, the carbohydrates. So people are tend to eat more more towards the junk food and less towards the vegetables and fruits, because they are not easily available, and plus they are a little bit pricier side. Supplemental nutrition programs to women, infants, and children of low income to help provide supplemental food, implement nutrition education, breastfeeding support, and access to health and social services. Implementing healthy food programs in the schools, providing healthy midday meals, nutrition counseling, and obesity screening programs. So now there should be this program should be started in the school, where they should be teaching us about the nutrition, like what amount of protein or what amount of carbohydrates, how many calories are required throughout the day in your body. Because if you eat more than what is required, it definitely converts it into fat, which can cause which to a severe like to extent can cause obesity if you're not working out or if you're not doing any physical activity. Next slide. Efforts of health related programs or policies to tackle obesity in India and their failures. Vibrant school health program with provision of obesity screening, but because of high workload in most of the government schools, it is often missed. In RMNCH plus A, reproductive, maternal, newborn, child, and adolescent health, no special emphasis to mother who delivers big baby. In primary health centers, primary care physicians pay no attention to treatment of child obesity. Activities are being executed at multiple levels to curb the junk food menace in school premises or canteens, but not because it is not yet a policy. Many schools are reluctant to practice. For supplementary nutrition, although caloric values of food are considered, quality is not given, and therefore no balanced diet is maintained. Anganwadi workers, which are also called social workers, or the workers who work in kids school, have lack of awareness and training for obese children. Mothers Absolute Affection MMA MA program is launched with an attempt to promote breastfeeding and counseling services for supporting breastfeeding, but since it was just a guideline and not yet an obligate policy, many sectors are not adhering. So how do we screen obesity? Firstly, we have BMI, the most common use scale that healthcare providers use. But does it help? No. So there is this one more scale where they measure your visceral fat. They measure your fat in percentage or fat in in kilograms, what amount of fat you are having. Waist circumference measurement. Fat stored in abdominal area is called visceral fat, which may further increase the risk of disease such as heart disease and diabetes. With a BMI in range of 25 to 34.9, a waist measurement of over 35 inches in women and over 40 inches in men is associated with increased risk of cardiovascular diseases. Other diagnostic measures are used to identify or evaluate obesity include a physical exam evaluating height, weight, vital signs, and general head-to-toe assessment, a health history, family history, history of weight loss or exercise, eating habits, a family history to review and probably evaluate the inheritance of obesity. Screening of obesity, the labs include our cholesterol levels, the good cholesterol and the bad cholesterol, which is HDL and LDL, which are commonly associated with obesity. Fasting blood sugar and hemoglobin H1B, HbA1c to check for the signs of pre-diabetic or diabetic. A thyroid test to observe for the signs of hypothyroidism, which can lead to weight gain. It is a symptom of hypothyroidism, so or only linked with obesity. Liver function test to screen for the potential of fatty liver disease, which often accompanies obesity, and electrocardiography, which can also be requested to look for the signs of heart disease, if any present, depending upon the impact of obesity on the patient's body. Thank you.
Next, recommended treatment for obesity depends on the severity of the disease. If the BMI is greater than or equal to 25, lifestyle modification like diet, physical activity, behavior modification can be implied. If BMI is greater than or equal to 27 with comorbidities, or BMI greater than or equal to 30 without comorbidities, pharmacotherapy can be used. If BMI is 35 or equal to greater than or equal to 35 with comorbidities, or greater than or equal to 40 without comorbidities, surgery can be employed. Lifestyle modification. For BMI greater or equal to 25, caloric intake should be reduced by 500 to 1000 calories per day. Increased physical activities, water intake, behavior modification, and keeping oneself busy in any work possible. Next, pharmacotherapy. For patients with BMI greater than or equal to 27 with comorbidities, or that greater or equal 30 without comorbidities, medications for weight loss like orlistat, which blocks fat absorption, phentermine, which induces satiety, lorcaserin hydrochloride, which reduces appetite and induces satiety. Next, bariatric surgery and metabolic surgery. For patients with BMI greater or equal 35 with comorbidities, or BMI greater or equal 40 without comorbidities, provides medically significant sustained weight loss, involves alteration of the GI tract that affects cellular and molecular signaling, and leads to a physiologic improvement in energy balance, nutrient utilization, and metabolic disorders. examined in many clinical studies for effects on weight and comorbidities. Next, WHO response, adopted by the World Health Assembly in 2004 and recognized again in a 2011 political declaration on non-communicable diseases. The World Health Organization Global Strategy on Diet, Physical Activity and Health describes the actions needed to support healthy diets and regular physical activity. The strategy calls upon all stakeholders to take action at global, regional, and local levels to improve diets and physical activity patterns at the population level. The Global Action Plan on Physical Activity 2018 to 2030, More Active People for a Healthier World, provides effective and feasible policy actions to improve physical activity globally. WHO published a technical package to assist countries in planning and delivery of their responses. Next, thank you.
Okay. Okay, obesity. I would have thought that India would be lower because of your diet, of your religion. That you're a third in obesity worldwide. Surprised. Okay, one of the common problems would be obesity because of malnutrition, supersize culture. Okay, so we have to let people know, of course, obesity would come, diabetes, hypertension, and other morbidities to prevent. Okay, so again,
Dr. Andres.
yes, Dr. Ray.
Yes, ma'am. Uh, we just want to remind everyone that BMI was not actually or originally developed to use specifically as an index for fatness in population-based studies. However, BMI was adopted for its use because of its readily available or readily obtained metric. What I'm saying is it should be understood that BMI has serious limitations when used as an indicator of percent of body fat mass. You've mentioned a while ago its limitation, right? So it can also be misleading in this regard, particularly in men. So the terminology currently used can also be prejudicial, right? Because it has to also be take into consideration the bone structure, right? BMI from in Western or Caucasian can also be different for those who are Asian or even Africans. So how can you able to um, dissolve such differences in this on this population, right? So obesity or overweight can also be different depending on which the population-based study you are actually conducting or basing. Okay?
Yes,
So
doctor.
there are a lot, yeah, there are other apometric measurements you could use, but not just basically rely on the BMI. Okay?
No, doctor.
Yes?
Yes, doctor.
You want to say something?
No, doctor.
But of course, as a general public health, BMI can also be incorporated in our preventative approach, right? And this can also be considered in the weight loss regimens, especially if you are targeting a specific way to measure certain weight loss. Okay, so variation in the body weight can be attributed to the weight loss, no? And of course, studies have shown that BMI has a strong correlation in the increased mortality and morbidity, particularly with your coronary heart disease and other metabolic syndrome. Okay?
Yes, doctor.
Okay. That would be all from my side. Dr. Andres?
Yeah. But again, as Dr. Navarro mentioned, BMI is objective because it is concrete and you are able to compute it. So it's commonly used. But again, we have other factors. Okay. Next group. So
Group 15, doctor.
next group, please.
Good morning, doctor. So today's our public health topic is teenage pregnancy. So what is teenage pregnancy? Teenage pregnancy refers to the pregnancy of a young woman aged between 10 to 19 years old. Pregnancy age below 10-year-olds are also comes under teenage pregnancy. So why should we focus on teenage pregnancy? Every year, an estimate of 21 million girls aged 15 to 19 years in developing regions become pregnant, and approximately 12 millions of them give birth. So at least 7 lakh births occurs to adolescents, girls younger than 15 years of age in developing countries. In a study of WHO trusted in WHO, the complications during pregnancy or childbirth are the leading cause of death globally for girls aged 15 to 19. And the study also showed us that the early sexual experimentation by teenage correlates with poor school performance and poor economic backgrounds. So the causes of teenage pregnancy will be gender inequality, peer pressure, pressure from an old male partner, and also rebellion against parents and sexual abuse. The other causes may be an unplanned pregnancy, alcohol, unprotected intercourse, eating, and some other aspects like some assumes that a baby will strengthen a relationship, or the prospect of giving up school appeals to her, especially if she is struggling to cope academically. So what are the consequences of teenage pregnancy? Teenage mothers are more likely to drop out of school. Only about 1/3 of the teenage mother obtain a high school diploma. And the teenage girls who often do not complete their schooling but also struggle to cope up with schooling in adolescence. And also single parenting. So 80% of teen mothers must rely on welfare because they lack the knowledge and skill to provide for the baby. So the younger the teen, when she gets pregnant, the more likely there will be another pregnancy in her teens. So repeated pregnancies increases when teens repeated pregnancies increases when teen are living in her with her sexual partner has dropped out of school. So sibling of adolescents parents have found out to be at higher risk for early sexual activity and adolescent pregnancy. So what are the health factors that affect the teenage mother? It will be anemia, preeclampsia, kidney damage due to preeclampsia, mortality, isolation, and dropping from school, and poor postpartum depression. So how does teenage pregnancy affect baby? The baby would be a low birth weight, preterm baby. There would be developmental disabilities, risk of infant mortality, social emotional problems, and increased risk for abuse and neglect.
So how does teenage pregnancy affect? How does teenage pregnancy affect the father? To stress, depression, to drop out high school, difficulty in facing the world, then to employment and to the social status. How does teenage pregnancy affect their social life? They become isolated, they feel guilt, they go into stress, depression, low self-esteem, eventually affects the interest in studies, lack of supporting groups and friends, limited job prospects. Do teenagers have knowledge about sexuality? Yes, they know very basic things on sex and contraception because information about sexuality is not provided by their parents. Many parents are worried about too much information will encourage teenagers to experiment with sex because of their own discomfort. Parents and educators are unable to provide accurate sexual contraceptive education as part of their learning experiences. Do teenagers have knowledge about contraception? No, lack of knowledge about contraception is the major risk factor for the teenager pregnancy. Many teenagers use condom and pills, but many out there lack of knowledge and skills using their contraception effectively. What are the contraceptive method? Intrauterine device, which is implanted inside the uterus, like copper T. The low dose of birth control pill is mostly used and safe for the teenager. Birth control implants in plastic sticks like insert into the skin under the arm, very effective, and it can stick in a place up to 5 years. Condom and contraceptive jelly reduce the risk for the teen pregnancy and for sexually transmitted diseases. Emergency contraceptive pills, also known as morning after pill, are effective if taken within 72 hours after having unprotected sex. Why do contraceptive fails? It's because of human error. Teenagers do not know how does it work, the contraceptive pills and other stuff. Incorrectly and inconsistently using the pill or how to use the condom correctly. Girls may miss a pill or fail to take their contraceptive pill every day at the same time as recommended. Some pills are affected by other drugs such as antibiotic and nullified by sickness or diarrhea. Social facts. Teenager lacks of courage to discuss sex with their parents, and they have no money and knowledge, the clinical stuff personally, making it almost impossible to access contraceptives. There are gendered assumption that only girls who carry or use contraceptives. Health professionals, they are not friendly and so they're giving lecture teenager when they approach them for the contraceptive. All contraceptive can fail, although some are more fallible than others. Successful family planning depend on how efficiently the person use the chosen method of contraceptive. Most teenagers do not know about the emergency contraceptive to take in 48 to 72 hours after unprotected sex, like rape and forced sex. Thank you.
Good morning, doctor. I'll proceed with balance.
How to cope with unplanned pregnancy? The priority should be to decide whether or not to continue with the pregnancy. Like only the priority is to first whether she is going to continue with the pregnancy or not, and later it should be discussed with her parents or family or her partner. But still, the decision should be gone with the teenager only. If she will to continue with her pregnancy, she should approach a clinic and she should have a proper antenatal checkup, everything. Or if she planned for aborting the child, she should be informed the proper procedure for that, and it should be done before the 12 weeks. And in some cases, the teenager will wish to give the baby for adaptation. Like in some cases, they will be unaware of that the teenager is conceived, and after when she came to know that she is conceived, it will be like the 12 weeks must be exceeded, so she will be thought of giving birth, and she will think she will give the baby for adaptation, as she is not willing to raise the child. Next slide. The pregnant mother must decide whether or not to tell the baby's father about the pregnancy. And also many teenagers, they will face this problem, like they will be thinking how to tell this news to their parents or their partners, and how they will react to these news, and this will make their career lifestyle more worse, and this makes them more stressful and emotionally depressed on. And some girls continue to take the contraceptive pills unaware that they have conceived. Like as I told before, many will be unaware that they are conceived, as they are thinking they have used contraceptive pills, but in many cases these contraceptive pills will fail to work, so they were unaware. In such cases, they will be like continue using contraceptive pills, but when at one point when they came to know that they are pregnant, at that time this will also make them more worried that something will going to happen to their baby, because they are continued their contraceptive pills. And somewhere, like because of due to lack of knowledge regarding these pregnancy, because in teenage life many were like unaware of what is pregnancy, because there is lack of knowledge. Because of that, they do not take any preconception precautions like avoiding alcohol, drugs, and smoking. And many do not attend antenatal care, because like from in most of the countries, many parents or partners, they won't accept this teenage pregnancy other than the married one. The school pregnancy, many parents, they won't accept. So in such cases, if the teenager is going to have the baby, it's against her family, so she'll be like struggling from the financial thing, so they will miss the antenatal care. This will increase the risk for high blood pressure as well as the premature births. Next slide. The teenager's reaction to the news of the pregnancy depend on her current family situation, her reason for wanting. Like as I told before, in many family, they won't accept. So when they hear the news of pregnancy, first thought what they think is like whether my partner will accept this, or whether my parents will accept, whether they will accept me, what should I do. Like, all these situations come to their mind, and she has to juggle the schoolwork with financial responsibility also. Like in some cases, the partner will be like with the teenager, like they won't leave the girl behind. So in such cases, the partner will also go through emotional problems, like they want to cope up with both the financial as well as they need to take care of the partner also. If the father is still at school, her fear of him entering new relationships bring uncertainty. Like the in between the school aging students, like maybe the partner will be also in the school. So the first thing what the girl think is like, maybe my partner will leave me behind and he will enter in new relationship, I'll be left behind. So many of these problems will come into her mind. Now, how to ensure the healthy pregnancy? If the teenager mother decided to give birth, these are the things to ensure. Like get early prenatal care, stay away from alcohol, drugs, and cigarettes, take prenatal vitamins, ask for emotional support. Next. Now, choosing single parenting. In most cases, single parenting is done for the teenage pregnancy, because not even the family members or partners will accept this. So in such cases, the child may lack a father figure and make male role model, as there won't be no male support for the parent.
The mother-child relationship can suffer in years to come if she is unable to tell the child the identity of the father. Like after the child born, when the child is going to school, many the course like her friends will ask who is the father. At that time, the child will be like, I don't know who is my father because only my mother raised me. So in such cases, the problem will arise between the mother and the child. She'll be continuously raising the question, who is my father? It may be difficult to get financial support from the father if he rejected his responsibilities, and the teenager mother may find it challenging to progress, and even average learners may become underachievers while trying to balance motherhood and schooling. Breastfeeding or expressing breast milk is challenging, and in light of daycare fees and cost of formula, family often put pressure on the teenage mother to give schooling up. Are we failing our teenagers? Yes, it is time to acknowledge that despite the advances with contraceptive advices and access, implementation of these policies reforms lack implementation. There are no consequences where schools violate policies, resulting in denying girls the right to education. Teenage girls do not have access for contraceptive because the clinics do not operate after hours. There are gender inequalities, and girls lack the ability to negotiate healthy sexual relationships. Our sexual education at school level is often haphazard, moralizing, and patronizing, and there are no health professionals at school level to help and assist the girl who had unprotected sex by administering emergency contraceptives. The most important thing is we should educate the students, mainly the teenage students in the school itself. There should be a sex education for all the students during the teenage time, so that they won't get into all these types of teenage pregnancy, as well as many other problems like alcohol, drug addicts, and so it is important to educate the teenagers during the school itself. It's important. And postnatally, the girl is expected to perform academically without consideration of the financial, emotional, and physical demands of childcare. How can we prevent teenage pregnancy? The best way is to avoid having sex, proper and correct usage of contraceptive methods, family life education, counseling and support programs can help to prevent teenage pregnancy. As I said before, implementation of contraceptive methods, contraceptive device should be easily accessible, campaign about teenage pregnancy. These are the references for our presentation. Thank you.
Okay. Teenage pregnancy is one of our concerns, of course, and you have discussed that extensively. Of course, best way to avoid teenage pregnancy is avoid sex. So that couldn't be stated any better. But if youth become sexually active, then they must be aware on how to prevent one, knowing their cycle, knowing what they could use, etc., etc. And that are the preventive measures for that. Okay?
Dr. Andres?
Yes, Dr. Ray.
Yes, ma'am. I am not sure if they were able to tackle the issue of incorporating the sex education in the curriculum or in school.
No.
Or if they're able to look into the approach, whether if it's in the Philippines or India, introducing sex education.
Ay, ito pala.
Have you tried to look into that to our reporters? What's actually the implication of having or introducing sex education in schools?
Doctor, nowadays,
when do you think is the best time for children to know about sex?
it's better to give sex education from the after when they enter the teenage, like from 11 or 12, so they will get more knowledge about what when they are going through their puberty and adolescent changes. So if first main thing, the parents, the family members, the parents should teach their children like what they are going through and what's they should teach, the teaching should begin from the home itself. After that, nowadays in India, like they are implementing sex education in the students schooling itself. Like in India, state Kerala, they implemented this subject in their study also.
Well, perhaps as you've already mentioned that the teaching should actually start from home, from the family. But are we actually teaching our family or the parents or getting them involved on how to approach their children properly when it comes to sexual curiosity of their children? So I think we also have to look into preparing the parents,
yes,
knowing
doctor.
knowing the things that they should share or they would react, because these are the things that would uh, uh, especially if the children are having a lot of changes in their bodies. So
Doctor, here in India, mainly the even the parents, like they are ashamed of talking all these things to their students itself. Like they think when even if the child asks something regarding that, they'll be like telling some other stories and they'll be like closing those things. They won't open up with their children. That's the main thing. First, we need to educate. Even for that educating also, no one is coming forward. Like they are embarrassed for talking all these things.
yes, and it comes also with your culture, right?
Yes, doctor.
That
But
sex
in
is actually a
educated
taboo.
families, now they are starting educating their children. But in now uneducated families, still they are thinking like that. If we even approach to tell them all these things, they will be like teaching us against that.
Okay, all right. Thank you,
Thank you, doctor.
Dr. Andres. Yes, next group.
Next group, please.
Hello, doctor. This is group 16, and our topic is addictive behavior, internet gaming disorder. Is gaming an addiction? Gaming disorder is defined in the 11th revision of the International Classification of Diseases as pattern of gaming behavior, digital gaming or video gaming characterized by impaired control over gaming, increasing priority given to gaming over other activities to the extent that gaming takes precedence over other interests and daily activities, and continuation or escalation of gaming despite the occurrence of negative consequences. For gaming disorder to be diagnosed, the behavior pattern must be of sufficient severity to result in significant impairment in personal, family, social, educational, occupational, or other important areas of functioning, and would normally have been evident or at least 12 months. Gaming addiction demographics show that males aged 18 to 24 are most at risk for gaming addictions. We can see that the males are 94% while females are only 6%. Time spent on gaming per week in US, according to the graph, shows that almost 18.2% of the age group people spend 4 to 7 hours gaming per week. According to the According to the article published by Times of India, it has compared gaming similar to the substance addiction. It shows that addictive chemicals work on medial temporal lobe of the brain, the seat of emotions and pleasure. They stimulate the nucleus accumbens, or a small group of cells on the inner side of the temporal lobe which regulate feeling of pleasure. These cells contain opiate receptors that make you feel elated once they get activated. Any addiction, be it to the substance or to gadgets, can stimulate these receptors. Once the frontal brain or the part gets used to the stimulation, it starts demanding the pleasure. We can see that several children have been secretly carrying cell phones all in schools since the physical classes resumed last month, was said by psychiatrists and psychologists. This can be due to COVID or the online classes that we all are going through, and the adolescents have no other entertainment So they got addicted to this gaming and gadgets. Next slide. Internet gaming disorders was included in classification of mental and behavioral disorder of the American Psychiatric Association as a condition for further study in 2018. Health concerns associated with gaming behavior are not limited to gaming disorders, but also include other aspects of health. Example, insufficient physical activity, unhealthy diet, problems with eyesight or hearing, musculoskeletal problems, sleep deprivation, aggressive behaviors and depression, and also psychosocial functioning. Internet gaming disorder, public health concerns. According to the WHO definition, a person with gaming disorder will demonstrate the following characteristics for at least 12 months. Problems controlling their gaming habits, seeing gaming as more important over other necessities and daily activities or work, continuing to engage in gaming even after its negative health and social problems have been identified or evident. Further research shows that gaming disorders can also be linked with anxiety, depression, obesity, sleeping disorders, and stress. People who remain physically inactive for a long period because of gaming may also be at higher risk of obesity, sleep disorders, and other health related issues, according to WHO. In India,
health consequences of video gaming. Video game related health problems can cause the continuous strain injuries, skin disorders, and other health issues. Other problems, according to the Shoja et al., include a condition that could be termed video game provoked seizure in a patient with a pre-existing epilepsy. Next is vision issues. Video game playing is associated with the eye problems. Extensive and fixed staring at a video game screen causes the eye strain because the cornea, pupil, and the iris are not biologically equipped for the chronic heavy viewing of digital image from the electronic devices. The visual system strain from the frequent video game use over the extended periods may result in a headache, dizziness, and in some cases the nausea and vomiting. Interestingly, there is some research that shows that gamers have an enhancement of the spatial distribution of attentions compared with the non-gamers. Musculoskeletal problems. Persistent gamers may also suffer from the musculoskeletal problems. A survey of the children indicated increased physical complaints associated with the video game playing. Such complaints range from pain in the hands and the wrist to the back and neck. Furthermore, a case report involving a 9-year-old teenager references PlayStation thumb. PlayStation thumb is characterized by the numbness, and the blister is caused by the friction between the thumb and the controller from the rapid and the persistent gameplay. Using dermoscopy, dermatologists discovered the hemorrhages and onycholysis in a patients with presented with the hyperkeratosis. Also, tendon injuries of the hands and the wrist from the tendon overuse is another health problem associated with the video game play. Obesity and overweight. Playing of the video game consistently has been associated with the obesity. This is maybe related to the lack of physical activity in the players. Alternatively, it could be that those who are less physically fit because of the obesity gravitate towards the less physically demanding activities, such as gaming. In either cases, several studies have linked televisions and the video games and increased body mass index. It has been estimated that children in the United States spend 25% of their working hours watching either televisions or playing of the video games. Furthermore, children who watch the most hours of televisions or the play video games have the highest incidence of obesity. In video games are replacing physical activities, and young people do not participate in the physical recreations or see playing of the video games as a form of the recreation. This may be part of the link between the time spent while playing video games and rise in the BMI in the teenagers. Seizures. Health concerns that video games may cause an epileptic seizure started in the early 1980s. The first medically documented case of the video game-induced seizure was reported in 1981. In 1993, a story in the popular press reported that A boy choked to death on his own vomit during a seizure triggered by the playing a video game. Similar but less serious incidents were subsequently reported by the news media around the world, ultimately motivating video game console the manufacturer to include data epilepsy warnings in the instruction manual for their gaming products. In 1994, it was reported that video games only cause the seizures in the people already predisposed to epilepsy and advised with people with a predisposition to epilepsy can greatly reduce the risk of seizure by staying 10 feet or more away from the TV set or wearing the sunglasses while playing the video games.
Social consequences of gaming addiction. People who are addicted to gaming encounter situations in which they have to choose whether to interact with the real world or continue living in their virtual one. Sadly, the real one often doesn't prevail. The scenario can just as easily involve shirking important obligations and events, and the person being let down need not necessarily be a friend. It could be a family partner or even children. Social consequences are very real part of gaming addiction. Addicted gamers spend so much time playing that their personal relationships get neglected and sometimes disappear altogether. Addicted gamers who are married often strain their marriage as a result of their compulsive play. Spouses are typically acutely aware of the challenging gaming poses to the health of the relationship, even when the addicted gamer is not. A quick search online for information about video game addiction yields multiple stories about detrimental and potentially harmful social decisions people have made because gaming takes priority above all else. One such story was about a man who installed an online gaming platform onto his laptop so he could play at work, even though he knew that getting caught would mean being fired. Yet another told of wife whose husband had begun playing all the time because he said it took his mind off his problems. Preoccupied with gaming, it's not just neglect that cost addicted gamers their relationships. Some of them talk so much about their game of choice to the exclusion of everything else that people no longer want to be around them. They can't or won't engage in real world conversations or be a source of support or encouragement to friends or family. Because their friends talk about other things, they begin to feel left out, which in turn causes them to feel irritated or offended. It doesn't occur to them that they have chosen to be left out by devoting all their time to gaming. Some of the physical consequences of video game addiction can lead to social consequences as well. For instance, an addicted gamer who loses sleep because he's playing so much simply doesn't have the energy to invest in relationships. Lack of sleep may also make the individual irritable and difficult to be around. Long-term consequences. The lack of social interaction that results from obsessive gaming can have long-term social consequences. An addicted teenager won't develop effective social skills, which will hinder their ability to develop and maintain healthy relationships in college and beyond. Suddenly, he's 21 but has the social skills of a 15-year-old child. The individual may lack the skills to establish friendships, relationships, or just hang out and enjoy people's company. The social awkwardness created by the isolation of gaming addiction unfortunately feeds the addiction. The gaming addict will likely retreat back to online world where relationships are easier and already waiting for him. The ramifications of relationship breakdown can be even more stark for adults. In severe cases, it can lead to failure of marriage, loss of family and friends, and inability to hold down a job. Gaming addiction is serious, though there still much debate about whether it is diagnosable disorder. There is clearly a segment of our society for whom gaming is more than just a casual pastime. These people need friends and family members who care enough to intervene and try to help them break the addictive cycle. Overcoming gaming disorder, because computers and gaming are now a ubiquitous part of our lives, it's often difficult for affected individuals to fully disengage from their addiction, but the nature of gaming addiction makes early intervention essential. Researchers believe that the consequences of gaming addiction, relationship breakdown, depression, anxiety, among others, can further deepen people's problem with video games. The vicious cycle can make it more difficult to finally break free from the damaging pattern of behavior that mark gaming addiction. While feelings of social isolation and boredom can suck people into excessive gaming, the escape, when taken too far, only serves to worsen underlying problems.
Global health approach in prevention of problematic gaming. The development of problematic gaming is a complex issue because gaming, unlike other commodities such as tobacco and alcohol that are harmful to health, is associated with some benefits, which include spatial skill improvements, enhanced creativity, and problem-solving skills, and smaller chance to have peer relationship problems. In a recent literature review published by UNICEF, it is noted that digital technology can have both positive and negative effects on child's well-being, depending on the activity and length of time. Determining how much time is too much depends on the age of the children, their individual characteristics, their culture, and broader life context. In view of the complexity of the issue and cultural differences, caution should be exercised when drawing conclusions or comparisons between different countries. Several studies have examined the risk and protective factors of internet addictive behavior among children and adolescents. Parental supervision has been found to be an important protective factor from internet and gaming addiction and is most influential among younger age groups where parents are likely to have a greater influence. We encourage parents to develop and empower their children's awareness and self-control. As children grow, parents may adjust their degree of supervision and delegate autonomy to their children according to their maturity and demonstrated levels of self-control. Parents should encourage their leisure time activities outside of gaming, psychotherapy to address comorbid or underlying issues, gaming disorders, their symptoms, causes, and treatment. American Psychological Association reveals that several million grown-ups play their video games. Despite this, the percentage of people having the disorder is very low. Most of the affected players their ages range from 18 to 50, as well as the male to female ratio is almost equal. The causes, well, there are major causes of gaming disorder, but sedentary lifestyle and obesity can play a role in the disorder. Some parents also blame that technology advancement can also cause the disorder among young children. The symptoms include massive focus on internet gaming, not being able to play less, as well as unsuccessful attempts to quit playing, deceiving family members, risk of losing a job or relationships due to internet gaming. The treatments include the main hello. So the main treatments for the disorder can be treated with the help of a mental health professional that has experience with impulse control disorders. Those people who are suffering from the disorder need to do more often physical exercise. Next. Excessive gaming impacts a significant minority of gamers, particularly children and adolescents across the globe, and is associated with marked functional impairment and psychological distress. In an increasing number of countries and jurisdictions, the problem has reached the magnitude of a significant public health concern. Since 2014, the WHO has undertaken a series of activities to investigate the public health implications of behavioral addictions. With the recent release of ICD-11 and inclusions of gaming disorder as a disorder for the first time, multidisciplinary development of prevention approaches to delay the onset and progression of problematic gaming is urgently required. And to summarize this, the DSM-5 notes that gaming must cause significant impairment or distress in several aspects of a person's life. This proposed condition is limited to gaming and does not include problems with general use of the internet, online gambling, or use of social media or smartphones. The proposed symptoms of internet gaming disorder include preoccupation with gaming, withdrawal symptoms when gaming is taken away or not possible, tolerance, the need to spend more time gaming to satisfy the urge, inability to reduce playing, unsuccessful attempts to quit gaming, giving up other activities, loss of interest in previously enjoyed activities due to gaming, continuing to game despite problems, deceiving family members or others about the time spent on gaming, the use of gaming to relieve negative moods such as guilt or hopelessness, the risk having jeopardized or lost a job or relationship due to gaming. Under the proposed criteria, a diagnosis of internet gaming disorder would require experience uh, of major of these symptoms within a year. The condition can include gaming on the internet or any electronic device. Although most people who develop clinically significant gaming problems play primarily on the internet, the research and the debate are ongoing. Some argue, for example, that gaming could be a symptom of an underlying problem such as depression, anxiety, not a disorder or addiction itself. Even while professionals debate, individual stories in the media point to struggles and devastation from the phenomenon. Thank you.
Okay, so addiction of any form, of course, is counterproductive to anyone's goals. So you have to look at reasons why a person gets addicted to something, be it gaming, be it alcohol, be it smoking, and look further down for the reasons. Okay, so in your case, it's internet gaming addiction. Of course, there are a lot of problems that are encompassing, as you have mentioned, and you have discussed that extensively. Okay, Dr. El Rey, you have questions?
Okay. None from my side po, Doc. Thank you.
Go ahead, next group.
Good morning, doctor. Good morning, doctors. Am I audible?
Yes, but no screen share yet.
Yes, doctor. I have turned on my screen sharing, doctor. Hello and good morning, everyone. This is Srinivasan Vaibhav from Group 17. Are my slides visible?
Yes, go ahead.
Today, we would like to discuss about public mental health problems during the pandemic, COVID-19.
Pinapal-kapalan mo nga eh. Kasi pag manipis maano, parang pag niluto siya, pag manipis na siya ginayat, pag niluto pa.
Introduction. What all do we know about mental health during COVID-19? It has multiple impacts that affects several age groups across the globe, across the population, all. That's why it is called PAN. PAN means everywhere. So it is called pandemic. It has also affected not only physical health, but also mental health. It has many neurological and psychological effects also. That means it affects both.
Weber, just wait. Resume the slideshow.
Yes.
Resume the slideshow because in screen sharing, your slides not visible.
Okay.
Sorry, doctor, for inconvenience.
Sorry. Oh, no. Are my slides visible, doctor?
Yes,
Yes,
Vaibhav.
go ahead.
Yes, go ahead.
Sorry for the inconvenience caused. Good morning, everyone. This is Srinivasan Vaibhav from Group 17. Today we will discuss about public mental health problems during COVID-19. Introduction. What all do we know about mental health and COVID-19? COVID-19 pandemic, we know, and means everywhere. That means it affects throughout the globe, throughout the country, throughout all populations and across all age groups. That is why it is called pandemic. So it has several effects, severe, and this can also affect our nervous system as well as our psychological system. Then this can also lead to PTSD, that means post-traumatic stress disorder, in both the patients or common people and even in healthcare workers and hospital staffs. And this will result in anxiety while returning to work. Some mental health, here MH stands for mental health. Mental health need that existed before COVID-19 and had not been dealt with has worsened. That means any depression or any other psychological disorder that occurred during the pandemic had even worsened, had gone beyond severity. And a recent HPFT stands for Hertfordshire Partnership Foundation Trust. This is a mental health foundation program in England. This exercise agreed that we all need a public health approach upon the demand for mental health services too, which means mental health and physical health are proportionally the same. Both can eventually get affected. And mental health and COVID-19, a growing crisis. At the starting of the pandemic, that is 2020 February, from February till August, those 6 months or 6.5 months, approximately 388,961 people were screened moderate to severe for depression and anxiety over and above what could have been expected prior to COVID-19 pandemic. Since late February to August 2020, additional 60,233 people were screened at risk of psychosis over and above what could have been expected prior to COVID-19 pandemic. Since March 2020, that is the following month, 131,122 people were screened depression, and they were reported to have suicidal feelings or self-harm, thinking on more than half the days. More people impacted by anxiety and depression. Per day, the number of anxiety screenings completed in the month of August was 535% higher than that of January before COVID-19 stress began. There were over 48,000 moderate to severe anxiety disorder cases and over 94,000 cases for depression screens. Loneliness and isolation is cited by the greatest percentage of moderate to severe depression, approximately ranging to 74%, and anxiety was ranging of 64%, screeners contributing to mental health problems. This means loneliness and isolation has already made their mental health worsened. That's why they have been suffering from depression and eventually anxiety. Now we'll discuss about psychological problems associated with COVID-19. Depression is characterized by low mood, tiredness, pessimism. Pessimism is the act or the behavior of thinking about all the negative impacts or bad outcomes of everything. And poor sleep, poor appetite, feeling helpless, guilty, and hopelessness. When any person thinks negative, eventually negative things will come to us. That is what happens when whatever we think, we do. because our body does what our mind thinks. That's why when anyone thinks negative or when they keep worrying about any bad outcome or any other trauma, bad things will eventually worsen. And gradual reduction in work output. When the mental state of mind of any individual is weak or is worsening, eventually their work or their normal everyday life will also be deteriorated. And elderly people are more vulnerable or they are more prone to mental health problems. Hence, special care such as a geriatric care center is needed for these people. How does the COVID-19 affect people's mental health? As the coronavirus pandemic rapidly sweeps across the world, it is inducing a considerable degree of fear, worry, and concern in the population at large and among certain groups in particular, such as the elderly and care providers, people with underlying health conditions, such as immunocompromised individuals. Hence, we included a video from World Health Organization to discuss further about the mental condition. Is the video playing, doctor?
Not playing.
Sorry, doctor. Opening now, doctor. Oh my God.
If the video won't play, just go ahead with your presentation. It's okay.
Doctor, just give
Yes,
me.
doctor, it has opened the doctor. Sorry for the inconvenience, doctor.
Give us a second, doctor.
Sorry.
Sama niya kaya?
Video opening, doctor.
Not playing.
Sorry about the delay, friends. The following presentation, the following topic will be reported by my group mate.
Okay, go ahead.
Substance use and addiction during pandemic. Some people have increased their use of alcohol or drugs. Weber?
Yes.
Previous slides, please. Previous slide. All right. So in public health, mental health terms, the main psychological impact. God. Okay, sorry. Substance use and addiction during pandemic. Some people have increased their use of alcohol or drugs, thinking that can help them cope with their fears about the pandemic. In reality, using these substances can worsen anxiety and depression. People with substance use disorders, notably those addicted to tobacco or opioids, are likely to have worsened outcomes if they get COVID-19. That's because these addictions can harm lung function and weaken the immune system, causing chronic conditions such as heart disease, lung disease, which increases the risk of serious complications from COVID-19. Next. Next slide, please. Weber, please, next slide.
Sorry for the interruption. Weber, you just remove your screen sharing. I will share my screen. Sorry for the interruption, doctor. I will share my screen. Kumkum, can you visible my slides?
No, Manu.
Okay, just wait. What happened? Is it visible now?
No. Yeah, visible.
Okay. I will go with the slide number.
12.
Okay. Just give me a second. Okay. Now is it visible now?
Yeah. Okay. So in public mental health terms, the main psychological impact to date is elevated rates of stress and anxiety. But as new measures and impacts are introduced, especially quarantine and its effect on many people's usual activities, routines, or livelihood, levels of loneliness, depression, harmful alcohol and drug use, and self-harm or suicidal behavior are also expected to rise. Next. So, during late June, around 40% of US adults reported struggling with mental health or substance use. Its anxiety or depression symptoms were 31%, whereas trauma or stressor-related disorder symptoms were 26%, started or increased substance use was around 13%, and serious considered suicide was around 11%. Next. Okay, so what is a stigma? Bad and often unfair feelings that people in general have about a particular illness, way of behaving. So, when does a stigma happen? It happens when a person defines someone by their illness rather than who they are as an individual. The level of stigma associated with COVID 19 is based on three factors. It is a disease that is new and for which there are still many unknowns. We are often afraid of the unknown. It's easy to associate that fear with others. Next. Okay. Avoid stigma and discrimination. Stigma can make people feel isolated and even abandoned. They may feel depressed, hurt, and angry when friends and others in their community avoid them for fear of getting COVID 19. Stigma harms people's health and well being in many ways. Stigmatized group may often be deprived of the resources they need to care for themselves and their families during a pandemic. Next. People who are worried about being stigmatized may be less likely to get medical care. To COVID-19 include people of Asian descent, health workers, people with COVID-19, and those released from quarantine. People who are stigmatized may be excluded or shunned, treated differently, denied job and educational opportunities, and be targeted of verbal, emotional, and physical abuse. Next. So, how to reduce the stigma? Getting the fact about COVID 19 from reputable sources such as CDC and WHO. Speaking up if you hear or see inaccurate statements about COVID 19 and certain peoples or group. Reaching out to people who feel stigmatized, showing support for healthcare workers. Next. Do not refer to people with the disease as COVID 19 cases, victims, COVID 19 families, or the disease. They are the people who have COVID 19, people who are being treated for COVID 19, or people who are recovering from COVID 19. And after recovering from COVID 19, their life will go on with their jobs, families, and loved ones. It's important to separate a person from having an identity defined by COVID 19 in order to reduce stigma. Next. So, how to help in coping with stress during this? Next. During time of stress and crisis, it's common for children to seek more attachment and be more demanding on parents. Addressing them together may ease their anxiety, maintain familiar routines in daily life as much as possible, or create new routines. Learn simple daily physical exercise to perform at home, in quarantine or isolation, so you can maintain mobility and reduce boredom. Next. Older adults, especially in isolation and those with cognitive decline, dementia, may become more anxious, angry, stressed, agitated, and withdrawn during the outbreak or while in quarantine. So provide practical and emotional support through informal networks, that is families and health professionals. Engage the family members and other support networks in providing informations and helping people to practice prevention measures, for example, simply hand washing. Thank you.
Doctor, I follow up the video that I left.
Okay.
I hope everyone listen the audio.
Manu can't hear the audio, bro.
Is it not audible?
No.
Okay. I don't know how to make audible.
We could forgo for lack of time. You just send the video to me so I could look at it or look up it on your own time. Okay?
Oh, sige doc, sige. Thank you. So that's all from the group 17. And now, doctor, if you have any question, then you can ask. Thank you, doc.
So mental health, as we have mentioned earlier, very important, especially now with the pandemic. Next group.
Thank you, doctor.
Good morning, everyone. This is Samreen from Group 18. Our topic is poverty and health. Next slide. So in our topic, the overview topics are definition of poverty, global poverty, poverty line, causes of poverty, types and indicator of poverty, poverty related to diseases. So now let's start with the definition of poverty according to the United Nations. Fundamentally, poverty is denial of choices and opportunities, a violence of human dignity. It means a lack of basic capacity to participate effectively in society. It means not having enough to feed and clothe a family, and not having a school or clinic to go to, not having the land on which we grow one's food or job to earn one's living, not having access to credit. It means insecurity, powerlessness, and exclusion of individual, households, and community. It means susceptibility to violence and often implies living in marginal or fragile environments without access to clean water or sanitation. And coming to the definition of poverty according to the World Bank, poverty is pronounced as a deprivation in well-being and comprises many dimensions. So now here I would like to mention some of the dimensions we are talking about. They are hunger and lack of shelter, lack of clean water, sanitization, and facilities, and not able to send the children to the school. It also include low income and the inability to acquire the uh, basic goods and services necessary for survival with dignity. Poverty also encompasses low level of health and education, poor access to clean water and sanitation, inadequate physical security, lack of voice, and insufficient capacity and opportunity to better one's life. About 9.2% of the world, or 689 million people, live in extreme poverty or less than $1.90 a day, according to the World Bank. Now, coming to global poverty, the world has made a huge stride, and that means a progress in overcoming global poverty. Since 1990, more than 1.2 billion people have risen out of extreme poverty. Now, 9.2% of the world survives on less than $1.90 a day, compared to nearly 36% in 1990. But the COVID-19 pandemic threatens to reverse years of progress in the fight against global poverty and income inequality, and it jeopardizes the future of generation of children. COVID-19 drew an additional 97 million people into extreme poverty in 2020, according to the World Bank estimates. More than a year into the pandemic, the World Bank stresses that there is still much we don't know concerning its impact on the global poverty in 2021. Historically, poverty has been calculated based on a person's income and how much they can buy with that income, but new multidimensional measures are more holistic. Now let's see how these poverties are measured. Poverty is measured by each country's government by gathers data through household surveys of their own population. Entities like the World Bank provide support and may conduct their own surveys, but this data collection is time consuming and slow. New forms of high frequency surveys using estimates and mobile phone technologies are being developed and tested. Now let's see what is poverty line and how the poverty lines are calculated. Poverty lines are called a poverty threshold, a line which is below which is difficult, if not impossible, to afford basic needs. The poverty line is determined in each country by adding up the cost of meeting minimum needs, such as foods and shelter. Household income that are too low to afford minimum needs, such as food and shelter, are below the poverty line. The income necessary to afford meeting minimum needs typically sets the poverty line for a country. Then the poverty lines are compared between the countries. The international poverty line is the standard poverty line for measuring poverty globally. However, relatively new measures such as Global Multidimensional Poverty Index, which includes measurement of health, education, and living standard, which are all the signs of the poverty. Or we can also say minimum amount of money required to purchase daily need is also known as poverty line. Now, what is international poverty line? An international poverty line currently set as $1.90 a day is the universal standard for measuring global poverty. This line helps measure the number of people living in extreme poverty and helps compare poverty level between countries. As the cost of living increases, poverty line increases too. Since 1990, the international poverty line rose from $1 a day to $1.25 a day, and most recently in 2015 to $1.90. This means what we could get in 1990 for $1, now we need to have 1.90 for the same thing. In addition to the lowest income poverty line at $1.90, the World Bank also reports poverty rate using two new international poverty lines that are a low midline income line sets at $3.20 per day, and another one is an upper middle income line sets at $5.50 a day. Now let's see the poverty line in India. The current poverty line is 1059.50 Indian rupees per month in rural areas and 1286 Indian rupees per month in urban areas. Below poverty line is a benchmark used by the government of India to indicate economic disadvantages and to identify the individual and household in need of government assistance and aid. Here we need here noting a point that is internationally an income of less than rupees 150 per day per head of purchasing power parity is defined as an extreme poverty. By this estimate, about 12.4% of Indians are extremely poor. Income-based poverty lines consider the bare minimum income to provide basic food requirements. It does not account for other essentials such as healthcare and education. Now, estimation of poverty line in India, according to the recent reports, more than a quarter of population living in rural areas of India is below the poverty line. Out of the total population living in the rural part of India, that is 25.7% is living below the poverty line. Whereas in urban areas, the situation is better than here is 13.7% of population living below the poverty line. A common method used to estimate poverty in India is based on the income or consumption levels, and if the income or consumption falls below a given minimum level, then the household is said to be below the poverty line. The Planning Commission estimate level of poverty in the country on the basis of the Consumer Expenditure Survey is conducted by the National Sample Survey Office of the Ministry of Statistics and Programming Implementation. Estimated based on the methodology suggested by an expert group. Now let's see what actually causes the poverty. The root cause of poverty aren't only a lack of access to basic necessity of life like water, food, shelter, education, or healthcare, but also inequality, including gender or ethnic discrimination, poor governance, conflicts, exploitations, and domestic violence also causes poverty. This inequality not only leads to a person or a social into poverty, but can restrict access to social service that could help people overcome poverty. The places most entrenched in poverty are fragile contexts, which can be entire country or area of the country. In fragile state, children and communities face higher rate of poverty due to the political upgrades, past or present conflicts, corrupt leaders, and many more due for the education, clean water, healthcare, and other necessities. Now let's see what are the types of poverty. Absolute relative poverty. Absolute poverty is when a person can afford the minimum nutrition, clothing, or shelter needs in their country. Relative poverty is a household income below a certain percentage, typically 50% or 60%, the median income of the country of that country. The measurement takes into consideration the subjective cost of participating in everyday life. For example, plumbing is a necessity in some places. Without plumbing, a person can be considered impoverished. But in other countries, plumbing is luxury. Relative poverty is useful for considering income inequality within a country. Situational poverty is depend on the situations. Generation poverty means generations. Poverty can be a trap for someone. To get out of poverty, they need opportunities such as education, clean water, medical facilities nearby, and financial resources. Without these basic elements, poverty becomes a cycle from one generation to another. Rural poverty, urban poverty, it depends upon the location. Thank you.
So these are the four main indicators of poverty: the poverty rate, poverty gap, human development index, and multidimensional poverty index. Multidimensional poverty index. Multidimensional poverty acknowledges that poverty isn't always depending upon the income. Sometimes a person's income might be above the poverty line, but their family has no electricity, no access to proper toilet, no clean drinking water, and no one in the family has completed 6 years of school. The Global Multidimensional Poverty Index looks beyond income to measure a person's healthcare, education, and living standards to determine the poverty levels. It was developed in 2010 by the UN Development Programme and the Oxford Poverty and Human Development Initiative. Within the categories of health, education, and living standards, there are 10 key standards of multidimensional poverty that include nutrition, child mortality, years of schooling, school attendance, cooking fuel, sanitation, drinking water, electricity, housing, and assets. If a person is experiencing deprivation in 3 months or more of these standards, then they are considered to be multidimensionally poor. The Global Multidimensional Poverty Index offers a thorough look at the poverty and can provide guidance for specific interventions necessary in each country to eliminate poverty. In the year 2021, Global Multidimensional Poverty Index covers 109 developing countries, out of which 26 were low-income countries, 80 were middle-income countries, and 3 were high-income countries. These countries are a home to 5.9 billion people, out of which 1.3 billion people, or more than 1 in 5 of whom are multidimensionally poor, account for about 92% of the population in developing countries, making the global MPI a key tool to measure and monitor poverty. In India, 5 out of 6 multidimensionally poor people are from low tribes or castes. The scheduled tribe group accounts of 9.4% of the population and is the poorest, with 65 million people out of the 129 million people living in multidimensional poverty. So this graph shows us 60 countries with both multidimensional and monetary poverty, in which the incidence of multidimensional poverty was higher than the incidence of monetary poverty. Serbia has the least incidence of multidimensional poverty, whereas Niger has the highest recorded multidimensional poverty. So this graph shows us the incidence and intensity of multidimensional poverty in India, which varies by castes. According to the report, India lifted 271 million people out of poverty between 2006 and 2016, where it reduced from 0.280 to 0.123 in 2016, which recorded the fastest reductions in the multidimensional poverty index values during the period, with strong improvements in areas such as assets, cooking fuel, sanitation, and nutrition. Next slide. Effects on physical health. The poverty, which is money worries, leads to unable purchase of food and the poor diet. And this leads to hunger, malnutrition, vitamin deficiency, mineral deficiency, poor immune, high chances of disease, and they are unable to do job, work leading to low income, which again leads to poverty. And the effects on mental health, money worries, which causes stress, anxiety, depression, hypertension, insomnia, suicidal tendency, where they are mentally disturbed, poor mental health, and they are unable to do work, which leads to low income and poverty. So pregnancy, poverty, which leads to poor diet, pregnant lady, delivering underweight babies, congenital abnormalities, growth retardation. They are unable to do job work because children are unable to grow properly, which leads to poverty. And education and jobs, less money, where they're unable to pay fee, afford education, low qualification, less job opportunities, where they have less salary jobs, which finally leads to poverty. Thank you.
So the next, diseases of poverty. According to the World Health Organization, 10% of global health research is devoted to 90% of the global disease burden. Research confirms that the majority of diseases in low-income countries are caused by poverty, known as diseases of poverty. They include infectious diseases, diseases related to malnutrition and poor health behavior. Poverty is one of the major social determinants of health. Main groups of diseases included are the big three diseases, HIV or AIDS, malaria and tuberculosis, neglected tropical diseases, zoonotic diseases, and other diseases which also includes non-communicable diseases. Poverty increases the chances of having these diseases as the deprivation of shelter, safe drinking water, nutritious food, sanitation, and access to health services contribute towards poor health behavior. At the same time, these diseases acts as a barrier for economic growth to affected people and families caring for them, which in turn results into increased poverty in the community. Next. Poverty-related diseases are classified based on causative pathogens, viruses, bacteria, protozoa, and parasitic worms. It affects the lives of more than 1 billion people globally and lead to millions of deaths in children or adolescents each year. These diseases primarily affect low and medium income countries, where they cause a major burden on population's health and have a considerable negative impact on economic development. Most vulnerable are those people who do not have access to adequate health care. Poverty-related diseases are both a consequence and a cause of poverty in developing countries. Poor access to adequate health care often leads to underdiagnosis, lack of treatment, or mistreatment, which results in high morbidity and mortality. Yet, if diagnosed early and properly, most of these conditions are entirely treatable or even preventable. Next. The most vulnerable ones are pregnant women and children in most of the countries. HIV and syphilis sadly compete as the number one risk of congenital transmission during pregnancy, and infections are very common. Lack of availability of affordable, high-quality diagnostics, however, often prevents diagnosis and timely treatment of this condition with desired consequences. Next. So the big three diseases are HIV, AIDS, malaria, and tuberculosis. Next. So what is HIV? It is a virus that attacks cells that help the body fight infection. There is no cure, but is treatable with medicine. So what is the difference between HIV and AIDS? HIV is the virus that causes infection. It damages the immune system by killing CD4 cells. CD4 cells are part of immune system, and HIV attacks and kills these CD4 cells. Loss of CD4 cells make it hard for the body to fight against the infection, whereas AIDS is the last stage of HIV infection. As infection advances to AIDS, the amount of HIV in the body increases and the number of CD4 cells decreases. Medicines can stop this infection from advancing to AIDS. Without medicines, HIV advances to AIDS in about 10 years. Next, please. So this is a association between poverty and HIV or AIDS disease. So this is due to poor people are more vulnerable to this disease because they don't take precautions. They don't follow or maintain any sort of hygiene. Due to lack of knowledge or unawareness, economic burden, or poor productivity, or lack of access to healthcare. Next. So 1.7 million new cases of HIV around the world were estimated in 2018, where poverty being one of the major factors contributing to this infection. Whereas low-income countries are considered to be hyper-endemic countries. 11,000 people die each day in sub-Saharan Africa due to complications from AIDS. Prevention of HIV includes education about condoms, HIV testing, dangers of sharing needles, and social awareness. HIV or AIDS usually affects adults in their prime income generating or childbearing years. The poorest people in most African countries suffer from malnutrition, lack of access to clean water, and have improper sanitation, which significantly increase their chances of contracting HIV due to compromised immune system. HIV or AIDS typically begins to infect a household's income during the illness of an HIV positive household member. Like if the household member is infected from the family, income starts declining due to medicine cost, diagnostic procedures, and so on. Next, please. So next disease is malaria. Malaria is a vector-borne disease caused by single-celled parasite, the Plasmodium protozoa, and transmitted by female Anopheles mosquito. One of the most common infectious disease. Malaria. The word malaria comes from 18th century Italian mala, meaning bad, and area, meaning air. It is also known as jungle fever or marsh fever. So the relationship between malaria and poverty. So people infected with the malaria, if not treated, lose opportunities for work and education. And poverty and financial difficulties have been obstacles to malaria prevention policies. Next, please. Risk factors are low income, lack of knowledge, poor sanitation, or poor living conditions. Malaria-stricken family spends an average of 1/4 of its income on malaria treatment. So, framework for analyzing the relationship between malaria, poverty, and vulnerability. This shows that how factors like institutional and household factors contribute to increasing the risk of developing malarial disease, which leads to treatment seeking patterns and has a great impact on economy, like income starts declining due to financial costs, intangible costs such as premature deaths, diagnostic procedure, test, transport cost, and funeral cost also. So how they cope or deal to this despite loss of income by managing financial balance, like borrowing or selling assets, income diversification, or diversifying crops, hiring labor, or labor substitution, which all lead to poverty. Next. So tuberculosis is caused by Mycobacterium tuberculosis, transmitted from a person via droplets from the lungs of people with active TB. Most infected ones are children and elderly. Signs and symptoms involve fever, night sweats, cough, weight loss, loss of appetite, fatigue. Risk factors involve HIV, genetic, smokers, diabetic patients, alcoholic, and illicit drug use ones. Next. Tuberculosis is the leading cause of death around the world, especially prevalent in sub-Saharan African and the Latin American and Caribbean region. It is increasing by rate of 6% per year in sub-Saharan African. Tuberculosis is closely related to lifestyle of poverty, overcrowded condition, alcoholism, stress, drug addiction, and malnutrition. This spreads quickly among people who are undernourished. According to the Center for Disease Control and Prevention in US, tuberculosis is more prevalent among foreign-born persons and ethnic minorities. The rates are especially high among Hispanics, Blacks, and Asians. Being infected with HIV increases the rate of activation of latent TB infection. This is because HIV weakens the immune system, which makes it harder for the body to fight against the infection. Next. So this is a relationship between poverty and tuberculosis. The poor ones will have high risk of infection, high prevalence of disease, worse outcome of disease due to less access to healthcare. Next. So this pie chart shows that infectious diseases such as pneumonia, diarrhea, and malaria are leading killers of children under age 5. Roughly 44% of deaths in children under 5 occur during the neonatal period. Next. So this graph shows prevalence of key TB risk factors by wealth level, in which first figure shows that use of tobacco in poor ones is high, shows a high risk for developing infection, and figure B is exposure to indoor air pollution. In this same, poor ones are at high risk for developing infections. Figure C and D shows that low BMI and daily intake of alcohol can also lead to high risk of developing disease. Figure E shows that HIV infection is seen among the middle and low income people more. And figure F lastly shows that the rich people are more prone to diabetes mellitus due to their lifestyle management and eating habits. So this contributes to only 20% of developing risk. Next. So the impact of COVID-19 on tuberculosis. Here, the blue boxes indicate the impact of COVID-19 on health service delivery and demand for TB, as access to these services has been severely disrupted by COVID-19, and which leads to more exposure towards the infection. And the red boxes indicate the impact of COVID-19 on vulnerability to tuberculosis. Yeah, that's it. Thank you.
So now I will discuss about the neglected disease. These are the three aforementioned diseases that are widely recognized and receive a higher portions of funding to develop ways to tackle them. However, there are a string of lesser known diseases which also have a devastating impact upon impoverished population. Based upon the spread of research in cure for disease, certain diseases are identified and referred to as neglected disease. These include the following disease: Africa trypanosomiasis, Chaga disease, leishmaniasis, lymphatic filariasis, dracunculiasis, which is also known as the Guineas worm disease, onchocerciasis, schistosomiasis, trichomoniasis. Diseases such as dengue, fever, cysticercosis, toxopsoriasis, leishmaniasis, and murine typhus are common in tropical areas. Varieties of Chagas disease are also being increasingly reported among the warmer and poorer southern states of the USA. Diseases such as measles and other respiratory infections and diarrhea are also strongly linked to poverty. Next. Malnutrition. Poverty can also contribute to worsening malnutrition by compromising the quality of food intake and bolstering hidden hunger, which is the deficiencies of essential vitamins and minerals. Malnutrition, also associated with HIV, impacts people's ability to provide for themselves and their dependents, thus limiting the human capabilities of both themselves and their dependents. HIV can negatively affect work output, which impacts the ability to generate incomes. This is crucial in parts of Africa where farming is the primary occupation and obtaining food is dependent on the agricultural outcomes. Without adequate food production, malnutrition can become more prevalent. Children are often collateral damage in the AIDS crisis. As dependent, they can be burdened by the illness and eventually death of one or both parents due to HIV or AIDS. Studies have shown that orphan children are more likely to display physical symptoms of malnutrition than children whose parents are both alive. Next. Management for poverty alleviations is through income assistance, food assistance, social security assistance, housing assistance, sanitation assistance, universal health care, education, national health policy, national health programs, and the primary care health center. The relation between poverty and health has become a key focus in recent international policy development. Development and economic discourse alike acknowledgement health as central to poverty reduction and socioeconomic development. The effect of hunger on labor productivity is estimated to reduce the gross domestic product by 6% to 10% per capita. Iron deficiency anemia alone account for 2 to 7% of foregone GDP in some developing countries. The Sumit, can you? The Millennium Development Goal, which is set by the UN, also tackles poverty and hunger. However, progress toward this goal has so far been mixed. The global poverty rate has fallen since 1990, with 100 million fewer people living in poverty. Nevertheless, the number of extremely poor people in sub-Saharan Africa doubles between 1981 and 2001 to 313 million. Progress in hunger reductions has been slow despite low-cost measures such as breastfeeding and increased availability of improved diet for pregnant and lactating women, nutritional supports for sick children, oral rehydration therapy, control of parasitic disease, and treatment of vitamin A deficiency. Next slide. So this is the diagrams of the main actions of health-related poverty alleviation programs in China. The government of China has explored ways to make health a multi-department priority and ensure cross-sectoral cooperation through a range of mechanisms and institutions. The World Health Organization 2010 Adelaide Statement produced a framework with health promotion as key policy components, which has successfully reduced health-related poverty. In 2016, the National Health Commissions of China, together with other relevant 40 ministries, issued guidelines for health poverty alleviation programs aimed to break the vicious cycles between poverty and illness by 2020. In 2018, six more concrete actions were proposed to achieve health-related poverty alleviations by 2020. Those actions include improved medical care insurance for the target poverty-stricken population, provisions of treatment and health management service covered by serious illness insurance for the poor with serious chronic disease, and by implementing preventions and controls of communicable and endemic disease using an integrated strategy in poverty-stricken areas aimed at controlling HIV or AIDS, tuberculosis, echinococcosis, schistosomiasis, and Cachin-Beck disease, and by also improving the delivery capacity in poverty-stricken regions and the country townships and village levels. It also supports maternal and child health and health promotions in poverty-stricken regions and by strengthening support system with priorities in policy making, project allocations, funding, and social support to reduce poverty in the area with most poverty. So that's from our group. Thank you.
I'm sorry, I was on mute. Okay, so poverty is one. Do we still have reporters? How many more groups?
There is one more group left, doctor.
Let's have the last group.
No, doctor, there are 2 groups.
2 groups?
Yeah.
Okay, let's have the next 2 groups. Okay, continue.
Sure, doctor. Good afternoon, doctors. This is Group 19 presenting you the topic of disinfection. I'm introducing my group mates here and especially the presenters, myself, Niharika, Lakshmi, Devi, Navneet, and Manohar. So now I'm going to introduce 2 important persons who gained an important role in the field of disinfection. The number one is Hungarian physician and scientist Dr. Ignaz Philipp Semmelweis, who introduced the value of hand washing with antiseptic solutions, who gained a considerable reduction in death rate from puerperal fever. And number 2 is British surgeon, medical scientist, and pioneer of antiseptic surgery and preventive medicine, Dr. Joseph Lister, who introduced the prophylactic application of an antiseptics to wounds and gained successful in reducing the number of wound infection. And the importance of disinfection or the control of communicable diseases, sterilization of sophisticated instruments which are used in the hospital settings, and treatment of infection of the skin and mucous membrane. So here are the definitions, which is often used in the disinfection field. So the number one is disinfectant, which is usually the agent and especially the chemical agent, which is used to destroy the microorganism, that is a harmful microorganism. And disinfection is a process which is done by with the help of disinfectant to destroy the harmful microorganism. And sterilization, we can say that a validated process to destroy all forms of viable microorganism, even including the bacterial spores. Antiseptic is a substance which prevents or arrests the growth of microorganism, either by completely destroying or by halting the growth activity process. And asepsis is prevention of contact with microorganism, and sanitizer nowadays, which is most common used in our daily lives during this pandemic, and it is an agent that reduces the number of microorganism, that microbial contamination to safe levels we can use in the hospital settings, homes, and public places, and everywhere. And sterile, which is a state of being free from all living microorganism. Hospital disinfectant, which is a disinfectant which is used especially for the hospital settings or clinical and mostly in the health professionals. And a germicide is an agent that destroys microorganisms, especially pathogenic organisms. And detergent, we can say it didn't have any antimicrobial property, but it can still be a surface cleansing agent by lowering surface tension. Cleaning, which is the process of removal of unwanted or unpleasant things, and deodorant, which is a substance that suppresses or neutralizes the bad odors. And for the properties and how you can say the disinfectant be an ideal thing, we can say the broad spectrum. It should be used in wide range of antimicrobial spectrum, and it should be a rapid kill as a fast-acting disinfectant, and it should be the ideal disinfectant should be survived even in the disruption of environmental factors, and it can be a toxic to microorganism. It can't be a toxic to human beings or living beings, and it should be compatible. Compatibility is like the disinfectant have ability to active even in all kind of surfaces, metallic and rubber or plastics, in type of. And residual effect on treated surface, which is it have to leave a antimicrobial film even after treating the surfaces, and have to be easy to use with clear label direction, as you see in this picture. And it can be odorless or pleasant odor, we can use in daily uses in hospitals, or we can use. So it have to be in a daily usage, and it should be affordable, soluble in water, and stability in concentrate or in a dilution form, and it should be a very good cleansing property and environmental friendly even after the disposal. Next, the types of disinfection should be continued by Navneet.
Coming to the types of disinfections, there are basically three types of disinfections. The first one is the concurrent disinfections. The second one is terminal disinfection, also known as the final disinfection. And third one is prophylactic disinfection, also known as precurrent disinfection. So coming to the first one, the concurrent disinfection. It is a type of disinfection that is done immediately after the discharge of the infected material comes out from the infected person's body. Examples are like disinfecting the surfaces or area contaminated with urine, feces, or vomit, and also disinfecting the contaminated linen, clothes, hands, dressing, aprons, gloves, etc. Next one. The second one is the terminal disinfection, also known as the final disinfection. It is a type of disinfection that is done right after the patient is removed from a room or a facility in order to care for the subsequent patient without the risk of acquiring an infection. Examples are airing and sunning of rooms, furniture, and the bedding. Next one. The third one is prophylactic or precurrent disinfection. This type of disinfection is done as a measure to prevent any onset of disease. Examples are disinfection of water by chlorine, pasteurization of milk, and hand washing. Thank you. This will be explained by Manogan.
Natural agents. We have two types. One, sunlight and air exposure. Sunlight have a ultraviolet rays and heat rays, and it occurs in under natural conditions. We directly exposure to sunlight is destroyed many disease-producing organisms such as bacterial and some viruses. Articles such as linen, bedding, and furniture. Next, air exposure. Air exposure acts as a evaporation of moisture, which is lethal to most bacterial and natural agents, or such as sunlight, air. Because of their varies, it is inexplicable to change the situation. It cannot totally depend on disinfection. Next. Next, physical agents. Burning. It is fully used by fire. It is best method to disposing the infected articles of small volume, but high temperature of fire will destroy all form of life. It is not good for all forms. Burning is not to be done in open air. Then burning is best to done in incinerator. Feces can be disposed of by burning. Dry heat is not so effective, and a germ destroys the moist heat. Expect too much higher temperature, and it will destroy or injure many combustible materials. Next, water. It is very useful method to sterilizing articles such as glassware, syringes, swabs, dressings, oils, French chalk, Vaseline, and sharp instruments. Hot air is only drawback. It has no penetrating power, and it is not suitable for destroyed or kill the bulky disinfection items. Hot air is done in air and should maintain the temperature of 160 to 180 degrees Celsius per hour to kill the all spores. Next. Autoclaving. Sterilizer is operated with a high temperature and pressure. It is called autoclaves and generate the stream under pressure. It is most effective sterilizing agent. Autoclaving divided into two categories. One is gravity displacement autoclaves and another one is high-speed pre-vacuum sterilization. It works same principle as domestic pressure cooker and widely used for hospital and laboratory. And it destroyed all form of life, including spores. It is most effective way of sterilization of linen, gloves, dressing, etc. And it is not suitable for plastic and any sharp instruments. Boiling. Boiling for 5 to 10 minutes will kill all bacteria, but not spores and viruses. We need to kill the spore. We need to 100-degree temperature. It is not possible in boilers. So boiling is suitable for small instruments and tools. It is not used for subcutaneous incision, rubber goods such as gloves. 30 minutes of boiling is adequate to disinfected utensils and bedpans. Negative side of boiling is it is slow process and it is not used for thick bedding or woolen materials. And next, radiation. It is used to sterilization the bandages, dressing, catgut, and surgical instrument. And one of the object is packed in plastic bag before the radiation. They will remain same until open the plastic bag. And the radiation has a high penetrating power with little and no heat effect. It is useful method, but it is more costly. And the commercial method of sterilization is carried out through gamma radiation.
Good afternoon, doctors. So I'm Lakshmi Devi, and I'll continue from chemical disinfectants. Next slide, please. Yeah. First we have the phenol. Lister, the father of antiseptic surgery, first introduced the use of phenol, carbolic acid, in surgery in the year 1867. It's produced by distillation of coal tar between temperatures of 170 degrees Celsius and 270 degrees Celsius. It's used as a standard to compare the germicidal activity of disinfectants. Commonly used phenol derivatives are cresol, then chlorocidine, and then we have the hexachlorophene. So this is more active against gram-positive than gram-negative bacteria. Bacteriostatic at high dilutions, usually applied on skin as prophylaxis against staphylococcal infections, potentially toxic and should be used with care. And the chlorocinol example, it's less toxic and less irritant. It's readily inactivated by organic matter, inactive during pseudomonas. Next slide, please. We have the chlorine. So coming to the halogens, we have chlorine first, followed by iodine. So chlorine used in the form of bleaching powder, sodium hypochlorite, chloramine. Disinfection is due to the release of free chlorine. Reacts with water to form hypochlorous acid, and they are very potent bactericidal, fungicidal, sporicidal, tuberculocidal, and bactericidal, used in water supply, swimming pools, food, and dairy industries. Next. So we have the iodine. Iodine solution or tinctures have been used as antiseptic on skin, example to prepare incision site prior to surgery since long time. And it's used as a skin disinfectant. One example would be betadine. Next. Okay, now the fourth one is the formaldehyde. So it's commonly known in solution as formalin. It's highly toxic irritant gas which precipitates and destroys proteins. It's used in both aqueous solution and also in gaseous form. 10% of aqueous solution is routinely used. Uses would be like the first one, like preservation of tissues for pathological examination, to sterilize bacterial basins, to prepare toxoid from toxin, for killing of bacterial cultures and suspensions, and also for to destroy anthrax spores in hair and wool. Next. So we have the alcohols. Ethyl alcohol and isopropyl alcohol are commonly used. It acts by denaturizing of bacterial proteins, no sporicidal or bactericidal activity. It's used as a skin antiseptic. So isopropyl alcohol is preferred to ethyl alcohol as it is better solvent and more bactericidal and less volatile. Next. will be continued by Niharika. Thank you.
Jansi?
Yes, Niharika. I'm sorry.
Factors affecting the efficacy
Actually,
of
my screen is.
sterilization. Hello?
Guys, the screen is visible?
Yeah.
Okay.
Yeah, it's visible.
Factors affecting the efficacy of sterilization. Next. The first factor is cleaning. So when there is a failure to properly clean instruments, that results in higher bioburden, like the presence of microorganisms on surface or inside the surgical instruments, and higher protein load and salt concentration. This will eventually decrease the sterilization efficacy. The pathogen type. The spore-forming organisms like the Bacillus species, Clostridium species, they are more resistant to sterilization. So the contaminating flora on these surgical instruments, they mainly consist of vegetative bacteria. Next. Jansi?
What happened?
Next. The third factor is biofilm. The before slide, Shashi? Yeah. Next. Yeah. The third factor is biofilm accumulation. This is microorganisms accumulation that reduces the efficacy of sterilization by impairing the exposure of the sterilant to the microbial cell. Next factor is lumen length and lumen diameter. So when there is an increasing lumen length and decreasing lumen diameter, it impairs the sterilant penetration. So in order to achieve the sterilization, we need forced flow through the lumen. Next. The fifth factor is restricted flow. So here the sterilant, it must come into contact with the microorganisms. But the device designs like the sharp bands and blind lumens, they may decrease the sterilization efficacy by preventing or inhibiting the contact of the microorganisms with the sterilant. Sixth factor is device design and construction. The materials used in the construction of the surgical instrument, they may affect the compatibility with the different sterilization processes. Next. Recommended disinfection procedures. First is for feces and urine. They should be collected in impervious vessels and disinfected by adding an equal volume of any one of the disinfectants like bleaching powder, crude phenol, cresol, formalin, and allowed to stand for 1 to 2 hours. Next, the feces, they should be broken up with a stick to allow proper disinfection. If none of the above disinfectants they are available, a bucket of boiling water may be added to the feces, which is then covered and allowed to stand until cool. After disinfection, the excretal matter, they may be emptied into the water closet or buried in ground. Next is for sputum. If the amount is normal, it should be best received in gauze or paper handkerchiefs and destroyed by burning. But if amount is considerable, as in TB hospitals, it may be disinfected by boiling or autoclaving for 20 minutes at 20 lbs pressure. Alternatively, the patient they may ask to spit in a sputum that is half filled with 5% aerosol. When the cup is full, it is allowed to stand for an hour and the contents may be emptied and disposed of. Third is for open areas. So usually through cleaning and exposure to direct sunlight for several hours will be sufficient. If necessary, the floors and hard surfaces, they should be prohibited for 48 hours. For any chemical disinfectants, they should be sprayed or mopped with one of the disinfectants like chlorine preparations, formaldehyde solution, phenolic disinfectants. The solution, it must remain in contact with the surface for at least 4 hours before final washing. These sterilization processes and disinfection procedures, they are used to eliminate microbial pathogens for the prevention of any transmission of diseases or any infections. Thank you.
Are you done?
Yes, Doc.
So that's for sterilization, hand hygiene, and the like. Okay, sorry for rushing you. Next group, please. Let's have our last group.
Hello.
Good afternoon, Dr. Fellow classmates. This is Abbas Montasser Makki presenting Group 20, and our topic is the immunization. So, why is immunization important for the community? So, immunization is one of the best ways in which a person can protect himself, his children and family, and even the future generation from the risk of infectious diseases. In other words, if one vaccinates, one can help wipe out the diseases that could spread now or into the future. A good example of that would be the smallpox, which due to the vaccination, we don't have it anymore at the moment. It was eradicated in the 1980s. So by making sure you and your family are fully vaccinated, you are not only looking after your own family, but also protecting vulnerable people in your community. The more people who are vaccinated, the fewer people will be infected and less widely a disease can be spread. So immunization saves lives. As recently as the 1950s, thousands of children died every year from diseases such as tetanus, diarrhea, and whooping cough. Luckily, it is rare for anyone in India or even the world to die from these infectious diseases now, thanks to the major vaccination programs introduced in the late 1970s and 60s, and which continue up to date. So, how do vaccination works? So all immunizations work in the same way. The vaccination uses your body immune system to increase protection to an infection before you come into contact with that infection. In other words, it's like being infected with the disease without suffering the actual symptoms, or maybe a mild symptom. That's mild symptoms. So if you come into contact with an infection after you've been vaccinated, your body works to stop you from getting the disease, or you may get just a mild case. Unlike other proposed approaches to immunization, such as homeopathy, vaccination have been rigorously tested to demonstrate their safety and effectiveness in protecting against infectious diseases. Next slide, please. So what about people who cannot be immunized? So some people in our community cannot be vaccinated. This might be because they're too young or too sick. You can help protect these vulnerable people by keeping your family's vaccinations up to date. When you get vaccinated, you are playing an important role in keeping yourself and your community safe. When enough people in the community are vaccinated, the spread of disease slows down or stops completely. This is because the disease can't move easily from person to person. So as long as enough people are vaccinated, the disease will not spread. This is called the herd immunity, which has been applied during the ongoing COVID situation that we're facing. So the herd community helps protect your friends, family, and others, especially those who cannot be immunized. Next slide. So talking about the modern outbreaks of the infectious diseases. So many infectious diseases are rare or not around anymore due to the gift of vaccines that have been invented. So thanks to the vaccination, but there are still infectious disease outbreaks happening around the world today. Majorly the coronavirus, which we are still suffering from up to date. It's a new disease that the world is still learning about. New research is happening all the time, so we can understand more about the disease, including the long-term effects. We have the flu, chickenpox, whooping cough, measles. These diseases still have occasional outbreaks in the world, mainly when introduced from other parts of the world. They could make a strong comeback if people stop vaccinating. We have the Zika, which in February 2016, the World Health Organization declared that Zika virus is an international public health emergency following outbreaks in Central and South America. Ebola, the vast majority of people suffering from Ebola live in Africa. The latest outbreak of Ebola virus started in the Democratic Republic of Congo in 2018 and still ongoing, unfortunately. So HIV, in 2020, approximately 38 million people around the world were living with HIV. There is still no cure, but current treatments allow patients to live long and healthy lives. So just note that there is no vaccine exists for Zika, Ebola, or HIV, but research is undergoing. So how new vaccines are developed? It can take a long time to develop a new vaccine. The development process is arduous, and the vaccine constantly monitored, even if after it's being used, to make sure it's safe and effective. So the phases of development include the research, discovery, preclinical, testing clinical, and testing and regulatory approval. Once the vaccine is approved, the vaccine is then manufactured and shipped to where it's needed. Furthers are closely monitored through trials and surveillance to see if they're effective and safe, and to look for any side effects. So in certain circumstances, increased resources, concurrent clinical trials, and funding can fast-track development, such as in the case of the COVID-19 vaccines. Some vaccines, such as the flu vaccination, need to be updated every year to respond to the changing infection strains and conditions. Who needs to be vaccinated? Well, it's very simple. Everyone or almost everyone needs to be vaccinated. There are some exceptions, though. Usually people with serious medical conditions, people who have HIV or a weak immune system as a whole, but don't ever decide against not taking the immunization except if it is being called out by a medical profession. So doctors usually advise people to take the vaccine based on their HALO, which is the health condition, age, lifestyle, and occupation. So vaccination is particularly recommended if you are a newborn or a young child, you have a newborn baby, you're pregnant or planning for a baby, caring for young babies, such as parents, grandparents, and day carriers. You're an old person, or you have planned to travel overseas. People who are medically at risk due to certain conditions such as asthma or treatment. So this diagram here shows us the HALO criteria, which is the health, age, lifestyle, and occupation. And this diagram shows us most of the vaccines that are being taken for each age group. Thank you. And now my fellow group mate is going to continue.
Okay, thank you, Abbas. A very good afternoon. So I'll start with this infographics, simple yet very detailed, which lets people to trace their national immunization schedule based on their health, age, lifestyle, and occupation. Hello, doctor, can you hear me?
Go ahead.
So next, for the current healthcare providers, and even for us being the future healthcare providers and have seen the COVID times when there was great resistance seen against vaccines, it is very pertinent for us to know that how to have a proper conversation about vaccination. First, we can start with listening with empathy. We should not dismiss the opinions of people, and we should acknowledge how they are feeling without necessarily agreeing to them. For example, it's okay to have questions or want more information before getting a vaccine. Second, we can ask open-ended questions such as, what have you heard about the COVID vaccines? Or what do you feel that way? Why do you feel that way? These questions elicit a response other than yes or no and can help you better understand their concerns and might also assist the other person in working through their thoughts. We can share only trusted information. So, when you don't know the answer, or if you are unsure about how to address their concern, offer to help look for the information. Asking for their permission might make them more willing to listen to you rather than feeling like you are pushing unwanted information on them. Next, we can also visit the WHO. People and us as well can visit the WHO website to find answers to common questions on vaccination, COVID-19 vaccines, and COVID-19 vaccine safety. We can also check for your local health department websites or consult with other trusted and expert sources, such as a doctor or nurse. Next, we should explore reasons for wanting to get a vaccination. We can share our own reasons and experience for wanting to get vaccinated so they can have a mutual understanding. We can talk to them about how getting vaccinated against COVID-19 could offer a path back to normalcy, such as, again, resuming of classes and social gatherings. If we previously had concerns that we worked through and ended up getting vaccinated against COVID-19, then we can share our thoughts that what reassured us. We can describe how vaccination will help protect them, their family, and a community as a whole, and bring back the activities and pleasures of the life that we have gone without. Now, other than these healthcare providers, how other organizations and vaccinators can help boost vaccine confidence? A range of organizations within and beyond the healthcare sector can play a vital role in sharing accurate information about vaccination and its benefits. They can start this by first leading by example. They can openly share their support for vaccination or personal experience of getting vaccinated. This can help promoting vaccination acceptance as a social norm in the workplace. Next, they can build trust of the people by being supportive who has questions or ask for advices. They can listen to any concerns and communicate in a way that is respectful and builds trust. Last is these organizations can help in breaking down barriers. They can make it more convenient for the people to access these vaccinations. Employers can pay for childcare or the travel costs of getting to the vaccination facilities, or offer paid time off for their employees to get vaccinated. Now, let's come to the Immunization Division at Ministry of Health and Welfare, India. In India, Immunization Division is a part of the Reproductive and Child Health Program under the National Health Mission and is placed at the Ministry of Health and Family Welfare. This division provides all the technical assistance required to undertake the activities under the Universal Immunization Program, which is one of the largest public health programs in India. It is one of the most cost-effective public healthcare interventions and largely responsible for the reduction of vaccine-preventable under 5 mortality rate diseases. Now, the key roles of this division include reviewing the state program implementation, planning and facilitating its approval process. It is associated with activities like routine immunization, holding campaigns such as polio, measles, and Japanese encephalitis, and monitoring adverse events following the immunization. These are all the vaccines and followed by all the diseases which are protected by the vaccination under this universal immunization program. Now, immunization surveillance. Now, to keep someone's family and community safe, governments need a complete picture of the immunization. That is where immunization surveillance comes in. Immunization surveillance involves researching and collecting information on immunization programs. Such a program is VPD surveillance, that is Vaccine Preventable Disease Surveillance System, which is present in the system in the healthcare schemes of our government, and it is used to create evidence base to enable planning and deployment of effective interventions. Now, IDSP is a case-based surveillance system for detection of early warning signals of outbreaks. Next, another surveillance system like this is the AEFI surveillance system. WHO defines this as a medical incident that takes place after an immunization, causes concern, and believed to be caused by immunization. AFI surveillance in country monitors immunization safety, defects, and responds to adverse events following immunization. It corrects unsafe immunization practices, reduces the negative impact of event on health, and contributes to the quality of immunization activities. Now, a special focus is being provided by Government of India to strengthen the system of reporting and responding to any adverse event following immunization. These are this is the suggested national immunization schedule, which is provided by the Ministry of Family and Healthcare Welfare. So with the help of this immunization schedule, people can trace their immunization schedule as well. Now, if we come to the schemes, already laid schemes by the Government of India for the immunization is routine immunization, whose objectives are to rapidly increase immunization, to improve the quality of the services, to establish a reliable cold chain system, monitoring of the performance, and to achieve a self-sufficiency in vaccine production. The scope and eligibility is under India has one of the largest universal immunization program in the world in terms of quantities of the vaccines used, number of the beneficiaries covered, and geographical spread and human resources involved. Under universal immunization program, all vaccines are given free of cost to the beneficiaries as per the national immunization schedule. Also, another point which is to be noted and which is helpful for the public is that all beneficiaries, namely pregnant women and children, they can get themselves vaccinated at nearest government or private health facilities or at any immunization post, such as Anganwadi centers or other identified sites near to their village, urban locality on fixed days. One more important thing is that this universal immunization program covers all the sections of the society across the country with the same high quality vaccines. If you look at the achievements of this scheme so far, is that the biggest achievement is eradication of smallpox. One more significant milestone is that India is free of poliomyelitis caused by wild polio virus for more than 33 months now. If you look at the coverage of this scheme, then it have covered 61% of the children in the country are fully immunized with all the vaccines. If you look at the other immunization campaigns which are running along with these schemes are the JE vaccination, Japanese encephalitis. Vaccination is provided as a part of the routine immunization program only. Other than that, measles supplementary immunization activities are there, and the most successful is polio eradication program in India. But along with these, there comes some risks and challenges. And these are imported. First is importation. That is a risk of importation of virus from the neighboring countries, Corona being the best example here. Surveillance gaps. If vaccination and immunization is not maintained and sustained, then a surveillance gap is there. Population immunity. The population immunity needs to be maintained in order to mitigate the risk of importation. Now, if we look at the COVID outbreak, then immunization services during and post-COVID-19 outbreak, current situation and guidelines. So based on the existing COVID-19 situation, all the administrative units are categorized into red and orange zones with active COVID-19 cases and green zones with no active COVID-19 cases. Areas where COVID-19 cases are reported are termed as containment zones, and areas which have risk of COVID-19 spread are categorized as buffer zones. And all these categorizations, these are a dynamic process and they are updated on a weekly basis or in fact even earlier. So during this COVID-19 outbreak, how immunization is affected, let's see. So based on this categorization, all districts are divided into containment and buffer zones and areas beyond buffer zones or green zones. In containment and buffer zones, neither health facility-based sessions nor outreach sessions are available. However, every opportunity is to be utilized for vaccinating beneficiaries if they have already reported at the facility. But in areas beyond buffer zones and green zones, both health facility-based sessions and outreach sessions are completely functional. It should be noted that birth dose vaccination at health facilities continues across the country irrespective of the district category. That's all for our presentation. Thank you.
Okay, thank you. Okay, we've had a long day. Sorry for extending, but we had to finish it. So next week, we will have an exam on all the reports that you've had. So make sure that you review the reports and the reports of others. Okay?
Hello, doctor.
Sorry, I think it's holiday next Tuesday. Next Tuesday.
Doctor, can you mention the date like it's 10th May, doctor?
May 3 plus, yeah, it's May 10.
And when will be our final examination, doctor? As we are planning to come back to Manila, so we are asking for the schedule.
Okay, May 10 would be your last exam.
Okay. Thank you, doctor.
We could have
it is a final examination.
If we could have it earlier, we could have it May 17. Or do you want it on the final schedule?
No, doctor, we want to, actually we are traveling back on May 17th, doctor, so we want it on May 10th only.
May 10 is your long exam. If you will travel May 17, we will have your exam finals. We'll have it the next week, and that is...
Thank you, doctor. Thank you for understanding.
25. Okay. All right.
Thank you, doctor.
All right. See you next Tuesday. Okay.